Morning, everyone. It is great to have you all here. My name is Christopher Bassi. I am the Program and Events Manager here at Nigeria Health Watch, and I am ecstatic as to the conversations that will be had here today in terms of nutrition coordination in the country. We'll start now by singing the national anthem. So I crave your indulgence. Could we all rise for the national anthem? Thank you very much.
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed. And so with peace and plenty, Nigeria may be blessed.
Thank you all. Can we be seated, please? Thank you. Again, so protocol, I would like to Again, welcome you all here, our physical attendees, including our virtual participants. I understand some of our panelists and speakers are currently around. We have Mr. Nuhu Kilishi, who is the Director for Nutrition at the Federal Ministry of Agriculture and Food Security. It's great to have you, sir. Yes, please, round of applause. Thank you. Thank you very much. We also have Mrs. Lillian Okafor, who is a communications officer at the Civil Society for Scaling Up Nutrition in Nigeria. Round of applause for her, please. And we have Dr. Fatima Zuntu, who is a technical assistant on nutrition from the Office of the Vice President. Round of applause, please. So at this particular point, I would like to call on Safia. I'd like to call on Safia Issa, who is the Deputy Director, Media. Sorry, my bad. Yeah, so I'd like to call on Safia, who is our Deputy Director, Advocacy and Partnerships, Nigeria Health Watch, to give the welcome remark. Thank you very much.
Thank you, Chris. Good morning, ladies and gentlemen. Thank you for making out time to be with us this morning. And we do apologize for the late start. And we're hopeful that our invited guests, especially our panelists, will be joining us within the shortest period of time. So, the Permanent Secretary, Federal Ministry of Budget and National Planning, in absentia, but we're expecting him. The Permanent Secretary, Gombe State Ministry of Budget and Economic Planning, we are expecting him in absentia. The Director, Nutrition, Food and Security at the Federal Ministry of Agriculture and Food Security, you're welcome, sir. The Director of Nutrition, Department of Health, and from the Federal Ministry of Health and Social Welfare, we are expecting her as well. Oh, you're welcome, Ma. Thank you so much. You're welcome. It's good to have you. Distinguished guests, our virtual participants, thank you. Civil society and the media. It is with great pleasure that I welcome you to this crucial forum. We gather today united by a common goal to address the coordination challenges that hinder our efforts to improve nutrition outcomes in Nigeria. Our theme, addressing coordination bottlenecks in Nigeria for improved nutrition outcomes, underscores the importance of seamless collaboration among all key players involved in nutrition programming. And I just want to say here that we do not lack policies, programs, frameworks, and the necessary infrastructure to actually run an effective multi-sectoral coordinated response for nutrition. But we are lacking in terms of the communication, the monitoring, and the united push as a united entity. And that is what we hope this forum will address. We are honored to have representatives from government ministries, departments, and agencies responsible for shaping and implementing nutrition policies and programs. We're also joined by development partners who continue to play a vital role in supporting and implementing nutrition initiatives, as well as the media and civil society, whose advocacy and awareness-raising efforts are indispensable to this cause. This forum comes as a pivotal time as Nigeria's nutrition landscape demands well-designed programs and strengthened coordination mechanisms to ensure their success. While the multisectoral nature of nutrition is well established, touching sectors such as health, agriculture, education, water, sanitation, and social protection, the real challenge lies in ensuring that these sectors communicate, collaborate, and work effectively. Today, we will explore the bottlenecks that have slowed our progress and develop actionable recommendations to address these challenges. Our discussions aim to strengthen partnerships and networks, leading to improved budgetary allocations and more efficient use of resources across sectors. By the end of today's forum, we expect to have concrete proposals that will improve coordination and contribute meaningfully to the One Conversation plan under the sector-wide approach of the Health Sector Renewal Investment Program. This is important for me to mention because we need to move and also speak the same language of the Health Sector Reform Program as we push towards this sector-wide approach and its full realization. This forum allows us to take stock of where we are and define a path forward. I'm confident that this room's collective wisdom and commitment will result in innovative solutions that bridge existing gaps, ensuring that our nutrition interventions are more coordinated, impactful, and sustainable. Once again, I thank you for your participation. I look forward to the productive discussions that will follow. Thank you very much.
Thank you very much for that. Round of applause again, please. So now, I'd like to call on Dr. Fatima Zuntu, who, as I mentioned earlier, is Technical Assistant on Nutrition, Office of the Vice President, for a guest remark. Round of applause, please, as she comes to the stage. Thank you.
Good morning, distinguished guests, ladies and gentlemen. It is a profound responsibility and a privilege for me to stand here before you today to discuss a topic of significance, of immense significance, prioritizing investments in nutrition for improved health outcomes in Nigeria. In the global arena of public health, nutrition forms the bedrock of human development, influencing our ability to thrive, to work, and contribute meaningfully to the society. Yet, in our national discourse, it often remains underfunded and overlooked. So today I intend to shed more light on why nutrition should be central to our health and national development strategies and how we can address the impending obstacles. The importance of nutrition as a foundation of health cannot be overemphasized. Good nutrition is fundamental to a person's well-being. It supports the cognitive development, serves as a foundation for life, particularly for women and children, who are the most vulnerable in our society. The benefits of investing in nutrition ripple through generations. Healthy mothers give birth to healthier children, and well-nourished children grow into productive adults. In this way, investing in nutrition isn't just a health intervention. It's a generational investment that empowers the future. Despite the critical role of nutrition, Nigeria continues to face daunting nutritional challenges. Our country is home to children who suffer from malnutrition. The statistics paint a sobering picture. 1/3 of our children under 5 are malnourished, stunted, and many others face wasting, micronutrient deficiency, and other forms of malnutrition. These conditions, if left unaddressed, have devastating consequences, not only for the individuals affected, but for the nation's future. So now, to address deep-rooted challenges, we must focus on making strategic and sustained investments in nutrition. And one-off intervention, though helpful in the short term, are not enough to reverse the trends of malnutrition. We need comprehensive, long-term investments that focus on maternal and child health, food fortification, and community-based nutrition. We must ensure that Nigeria is at the forefront of this initiative. Targeted interventions like food fortification with essential micronutrients have proven to significantly reduce malnutrition and improve overall health outcomes. Furthermore, maternal and child nutrition that provides critical support during pregnancy and the first 1,000 days of life can make an enormous difference in preventing malnutrition and promoting healthy development. However, for these programs to succeed, we need committed funding and political will at all levels of government. So how do we leverage partnerships for greater impact? One of the biggest lessons I've learned in the global health community is that collaboration is key to scaling effective interventions. We need to create and sustain partnerships between the government, the private sector, development partners, CSOs, NGOs, and what have you. Each of these stakeholders bring unique strength to the table, from the financial resources to the technical expertise and the on-ground experience. The role of private sector improving nutrition cannot be overemphasized. From the agricultural industry, ensuring food security, to companies investing in food fortification, private sector engagement is critical. The government must provide regulatory framework and policy direction that enables these collaborations to flourish. The CSOs, on the other hand, plays a vital role in advocacy, monitoring, and ensuring that these interventions are reaching the most vulnerable populations. The collective action is key to overcoming the fragmentation that often hinders the success of nutrition programs in the country. So investing in nutrition isn't just a moral imperative, it's also a smart economic strategy. The links between nutrition and economic growth are undeniable. According to the World Bank, for every $1 invested in nutrition, there is a return of at least $16 in investment. But on the other hand, malnutrition can cost countries as much as 11% of their GDP due to lost productivity or increased healthcare costs. So you see why it's very important to invest in malnutrition. In Nigeria, the economic burden of malnutrition is staggering. Poor nutrition weakens our labor force, increases absenteeism, and drives up healthcare expenses. On the other hand, by investing in malnutrition, we reduce healthcare costs, improve worker productivity, and create a more resilient and healthier population. A population that is well nourished, better equipped to withstand health shocks, and contribute more effectively to the national economy. So in essence, investing in nutrition is investing in the future economic prosperity of Nigeria. So in conclusion, as we gather here today, let us remember that nutrition isn't just about food. It is about equity, about health, about population. We must act now, and we must act very fast to prioritize investment in nutrition as a central part of our national and development agenda by addressing the coordination bottlenecks, strengthening partnerships, and ensuring there is an adequate and sustained funding, because the future of our dear nation depends on this. So at this junction, I would like to commend the Nigerian Health Watch and the organizers of this program for their tireless efforts in ensuring nutrition advocacy and also touching numerous and countless lives. You have done so much for the good people of Nigeria, and I must commend you for that. Today is an event that reminds us that we have a very, very serious or an important work that lies ahead of us. And it is a testament of our collective will to make a difference. So I encourage all the participants here to make most use of the knowledge and the insights that will be shared here today, because it is these initiatives that will bring about lasting and impactful change. And as we continue to engage in such meaningful discussions like this, let us remember that the future of our country that, that the future of this nation, the future of our children, and the future of our communities depends on having sustained and improved nutrition in the country. Thank you so much.
There's a round of applause again. Thank you very much, Dr. Zuntu, for that very, very charging remark. Indeed, nutrition really isn't just about food, and investing in nutrition is investing in the economic development and prosperity of our country. So we're looking forward to the conversations that will be had here today with regards to that. If we would look at the screen, so we understand that there will be questions that will be asked right now as we call up, well, as we anticipate the panel discussions that will be had. So for those of us who have phones handy in the room, if you scan the code, it will take you to the mentimeter.com where you could submit your questions, and hopefully with the availability of time, would ask them for this. And also for our virtual attendees, the code to use, log into mentimeter.com and use the code above to access the page to submit your questions. So we look forward to addressing these questions or whatever inquiries you may have. At this point in the program, I'd also like to acknowledge one of our speakers that came in while Dr. Zuntu was giving her speech. We have Mr. Jalu Ibrahim Ali, who is the Permanent Secretary for the Ministry of Budgets and Economic Planning, and also serves as the chairman of the State Committee for Food and Nutrition in Gombe State. So please, round of applause for him. We're so happy to have you here, sir. At this point, I'll be calling on Adana Opara, who is a program manager at Nigeria Health Watch, for her presentation. Thank you very much. Round of applause, please.
Good morning, everyone. Distinguished ladies and gentlemen, we are welcome to the Nutrition Forum to discuss coordination bottlenecks that are impeding us meeting the nutrition targets that have been set both by the global bodies and also national targets in Nigeria as well. So today I'll be taking us through some of the coordination bottlenecks that have been discovered to be impeding progress in Nigeria. You know, it's basically to lay the foundation of the discussions that we'll be having today during the panel sessions. So we'll look at the rationale for coordination. Why are we talking or discussing about coordination bottlenecks in Nigeria? We'll look at, you know, nutrition issues in Nigeria. Some of the nutrition interventions that have, you know, been put in place to address these nutrition issues. And then we'll look at coordination, the structure of coordination in Nigeria, multi-sectoral coordination, as well as coordination gaps. Next slide, please. So why are we talking about nutrition coordination? Why are we talking about multi-sectoral coordination for nutrition? We know that malnutrition is still an issue of public health importance in Nigeria. It's still an issue of public health concern. We also know that the causes of malnutrition are multifaceted and they require a multi-sectoral approach. They require stakeholders from different sectors, you know, addressing the issue of malnutrition in Nigeria. Next slide, please. We know that, you know, this is the conceptual framework for malnutrition. Like I said, it's just buttressing the point that the causes of malnutrition are multi-sectoral, they are multifaceted. we can see how the basic causes lead up to the underlying causes, as well as the immediate causes, which basically the health sector tries to address, and as well as WASH sectors, the education sector. So these sectors need to come together, need to coordinate together and collaborate to address the issue of malnutrition in Nigeria. We also know that there are nutrition-specific and nutrition-sensitive interventions, also calling on the fact that there is need for coordination and collaboration among sectors to work together to achieve and address the issue of childhood undernutrition. Next slide, please. So some of the nutrition issues in Nigeria, we talk about the triple burden of malnutrition, and that's when we have these three issues coexisting among maybe a particular population or a particular family. We talk about undernutrition, which is stunting, wasting, and underweight. We talk about overnutrition, and these days we can see that the prevalence of overweight, obesity, and diet-related non-communicable diseases. We also talk about micronutrient deficiencies. These are deficiencies in vitamins and minerals that are necessary for good health. So, looking at the prevalence of nutrition issues in Nigeria, we know that currently our stunting rate, according to the 2018 NDHS, is at 37%. And stunting represents a low height for age, like we know. So the child is too short for a child of his or her age. And it's a result of chronic or recurrent malnutrition. It's associated with poverty, with poor maternal health and nutrition, as well as frequent illnesses and care practices, especially earlier on in life. A second issue with undernutrition that we'll be looking at is wasting. The prevalence of wasting in Nigeria is 7%, according to the NDHS, and it's when a child has a low weight for the height. So the child, has taken a low intake of food of adequate quality or quantity, and has been exposed to frequent illnesses or prolonged illnesses. So it's often as a result of more recent or acute and severe weight loss. And then finally, we'll be looking at the issue of underweight as well. And we know that the prevalence of underweight in Nigeria is 23%, according to the NDHS as well. And this is a composite measure that features both stunting and wasting occurring at the same time. So for the second issue, which is overnutrition, we'll also be looking at obesity and overweight. The prevalence of that is 20.3% in Nigeria, and the prevalence of obesity is 11.6%. So we have also diet-related non-communicable diseases such as diabetes, hypertension, cancers of different sorts. So basically, it's just painting a picture that these are still issues of public health importance in Nigeria, or public health concerns in Nigeria. Like previous speakers have said, there are no dearth of strategies or tools to address the issue of malnutrition. The key issue is the issue of coordination. How is the coordinating body able to bring together multiple sectors to come together to address this issue of malnutrition in Nigeria? So for micronutrient deficiency, we talk about anemia, iron deficiency anemia, and the last NDHS showed that 68% of children suffer from some kind of iron deficiency anemia, while the prevalence for women of reproductive age stands at 58%. Of course, we can't talk about nutrition without talking about exclusive breastfeeding rate, and currently we are standing at 29% for exclusive breastfeeding rate. These figures are far below the targets that have been set by the global and national bodies to address the issue of malnutrition in Nigeria. So these are just some of the national targets that have been set, by the government of Nigeria to address the issue of malnutrition. So the government wants to reduce the proportion of people that suffer from hunger and malnutrition by 50% and increase the rate of exclusive breastfeeding in the first 6 months by 65%. Currently, like I said, the exclusive breastfeeding rate stands at 29%. So you can see that we're far below the target. And these targets are supposed to be met by 2025, which is barely a year from now. The rates of stunting, the government wants to reduce it to 18%. The current rate of stunting is 37%. We have childhood wasting, so that's the only indices that we can say that we have some measure of improvement. The government wants to reduce it to 10%. We are currently at 7%. For anemia among pregnant women, we can see that the target, 2025 target, is to reduce it to 40% among women of reproductive age. And it currently stands at 58%. And for the prevalence of diet-related non-communicable diseases, the government wants to reduce it by 25% by the year 2025. So in looking at the issue of nutrition coordination in Nigeria and looking at, identifying what are the coordination gaps, the methodology used was content analysis of different policies, the National Policy on Food and Nutrition, the National Multisectorial Plan of Action for Food and Nutrition, policies on infant and young child feeding, as well as the agri-sector food and security and nutrition strategy, as well as review of a number of literature. So for the structure of nutrition coordination in Nigeria, we know that at the national level, the National Council on Health, which is chaired by the Vice President of the Federal Republic of Nigeria, is the key decision-making body for nutrition coordination in Nigeria. And the Ministry of Finance, Budget and National Planning are the focal point for all Nigeria's food and nutrition policy. So they are the coordinating structure for nutrition policies, nutrition programs in Nigeria. And they are the coordinating structure that is supposed to bring about a multi-sectoral collaboration among different sector stakeholders. We also know that at the national level, we have the National Committee on Food and Nutrition, which is the technical arm of the Nutrition Council of National Council on Nutrition. At the sub-national level, we know that the ministries, the various ministries of economic planning at the state levels are supposed to be the coordinating mechanism for nutrition coordination in Nigeria at the state level. And this is also trickled down to the state, the LGA level, the ward level, where we also have LGA and state ward level food and nutrition committees created to handle the issue of coordination as well. So we know some of the efforts that the federal level or the national level has made in terms of nutrition coordination in Nigeria is the launching of the 5-year National Multisectorial Plan of Action for Food and Nutrition in 2021. It's a 5-year plan, and it's basically to guide the intervention efforts of various stakeholders, including MDAs, the organized private sector, civil society, academia, local NGOs, international development partners, and donors. So that document is a costed document. It tells us the amount that is needed to address the issue of malnutrition in Nigeria. And it also clearly defines the roles of the various stakeholders that are supposed to come together to impact nutrition outcomes in Nigeria. So looking at some of the coordination gaps that was discovered from the review of literature, review of policies and plans, the first of those gaps is the lack of clarity on responsibility for multisectoral coordination. So what this means is just that some of the articles reviewed show that some officers were not certain, especially at the subnational level, who is supposed to coordinate nutrition issues. Yes, we know that the Ministry of Budget and National Planning is supposed to coordinate at the national level, but at the state level, who is supposed to coordinate? Is it the Federal Ministry of Health? Is it the Budget and Planning, National Planning Ministry? So there were these questions that were asked, from the literature review that was conducted, that there was confusion about responsibilities, and this weakens collaboration among MDAs. So the lack of a designated body that is responsible for multisectoral coordination often creates gap in accountability. So nobody is owning the outcomes, nutrition outcomes, because we are not working together. Another coordination gap that was discovered or identified was inadequate interministerial or multi-sectoral collaboration. So coordinating bodies, the bodies that are supposed to coordinate, lack the capacity, especially in terms of funding, to call for meetings, to bring all sector stakeholders together around one table to discuss the issue of nutrition. So in terms of funding, in terms of human resource, there was this lack of multi-sectoral collaboration, inadequate policy and strategy implementation, especially at the sub-national level. So there was weak integration of national nutrition policies and strategies into multi-sectoral plans at the sub-national level. The government has put together a plan at the national level, but integrating these plans or domesticating it at the sub-national level is also key. And ensuring that the plan is adequately implemented, there's skilled manpower to implement all the interventions, funding, was not found to be available. So this is one of the challenge. Like I said, insufficient funding and resource allocation. So in some sectors, plans of actions, there was no budget line for nutrition activities, especially in nutrition-sensitive sector plans. And this inadequate or insufficient budgetary allocation and release for nutrition-specific and nutrition-sensitive activities. So these gaps often lead to fragmentation of intervention and resources. We see MDAs, development partners, managing their budgets independently. And the partners often working in silos independently, sometimes working in similar locations while neglecting other locations. This duplication of efforts definitely will lead to a waste of resources, gaps in coverage of intervention, especially for those locations that are neglected. Then we have a lack of technical capacity at subnational levels. So the technical capacity to coordinate, like I said before, nutritional activities at the subnational level, especially where the issue of malnutrition is very key, is often inadequate. Sometimes we don't have nutrition experts, at positions of authority, or even having nutrition directorates in other organizations, multi-sectoral organizations. We don't have such existing with key nutrition experts. So this is one of the coordination gaps that was identified, as well as limited community involvement in program design and implementation. So many of the nutrition programs designed and implemented came with or were implemented with minimal input from the local communities. And this top-down approach limits the cultural relevance and effectiveness of the programs, especially in the rural areas where the traditional practices and beliefs play a significant role in nutrition behavior. Finally, we also have weak monitoring and evaluation systems, data systems. We have inadequate data collection and information sharing across multiple sectors. I don't know if there's any dashboard where multiple stakeholders can come together and put, what they are doing in nutrition and put the indices that they are tracking in their various programs so that we know where the gaps are in addressing nutrition in the country. Finally, I would like to say that for us to address the issue of malnutrition in Nigeria, like previous speakers have said, there is definitely need for better and more effective coordination. The tools are already there, the programs are there, the interventions are there. We don't lack those. But what we lack is an effective multi-sectoral collaboration among different sectors in the economy. And I believe that today's discussions would look into these gaps and provide actionable recommendations to address the gaps so that we can have improved nutrition outcomes in Nigeria. Thank you.
Round of applause again, please. So, as we can see from the presentation, there indeed are gaps that we hope to have conversations today address in terms of nutrition coordination within Nigeria. At this point, I'd like to show we've had some engagements on our Mentimeter. So if you could throw that up. And these are some of the expectations from our online participants. People want to learn about the issues. people want to learn more about how we contribute, okay, yes. So, some of our expectations from this particular event, people want to learn about the issues on nutrition in Nigeria and also be able to hear about possible solutions to mitigate this. I'm glad to announce that, yes, we indeed have panel discussions that will be talking directly to these inquiries. Okay, so we seem to be having some technical issues with this. But just to let you know, again, please, if you have questions to ask, send them in through the Mentimeter. It will be uploaded or it will be projected intermittently during the session as we go on. So at this point, I will be calling on... Oh yeah, and just before I introduce the moderator for the second panel, I also want to acknowledge the presence of the Director and Head of the Nutrition Department, the Federal Ministry of Health and Social Welfare, Mrs. Ladi Bako Ayegbusi, MNI. Please, round of applause for her. It is great to have you with us, Ma. Thank you very much. Again, who is the Deputy Director, Advocacy and Partnerships at Nigeria Health Watch. She shall be moderating the first panel. Please, a round of applause for her as she comes to the stage. Thank you. Thank you very much.
Thank you, Chris. Good morning again, ladies and gentlemen. And it is with great privilege and honor that I moderate and invite the panelists for this very first panel discussion. The panel is titled Multisectoral Coordination Challenges and Opportunities for Improvement in Nutrition and Food Security Outcomes. The very first panelist on this discussion is the Permanent Secretary, Federal Ministry of Budget and National Planning, Dr. Vitalis Emeka Obi, who will be joining us as soon as he arrives the venue. He will join the panel discussion. After recognizing him, I will move to the very next panelist that I would like to invite to the stage. Jallo Ibrahim Ali, MNI. Jallo is the Permanent Secretary, Federal Ministry of Budget and Economic Planning from Gombe State. Thank you very much, sir. Next, I want to invite Malan Nuhu. Anywhere, sir. Malan Nuhu Kilishi, the Director, Nutrition and Food Safety, Federal Ministry of Agriculture and Food Security. Thank you very much, sir. Next to the stage, I'd like to invite the Director and Head of Nutrition Department, Federal Ministry of Health and Social Welfare, Mrs. Ladidi Bako Ayegbusi, MNI. Thank you very much, ma'am. I will be joining the panelists as well. Thank you so much for making out time to be with us this morning and to discuss this very, very important subject. We have heard from the presentation on the coordination gaps, and there is a target, 2025, for us to be making good on those multisectoral responses that are supposed to improve our health and overall nutrition outcomes. We've heard some very interesting conversation about the first 1,000 days of life, the need to invest for the economic prosperity of our country. And as I mentioned, that there is no scarcity in terms of policies, programs, frameworks, guidelines, templates that are supposed to lead us to make those differences in those indices, but somehow we seem to be stalled, or we seem to be struggling in terms of getting these responses to actually speak to our targets. So, sir, Jalo, I would like to start with you, because we have an example from Gombe about the accelerated nutrition program that you implemented. It was the first pilot of a co-convergence program that had a number of MDAs responding, and we are interested in some of those key lessons learned. And I think my very first question would be that what practical strategies or models have contributed towards this achievement? We are interested in learning how you were able to just put it together and get everybody on board to actually collaborate. Thank you, sir.
Okay, thank you very much, and thank you for having me. Of course, in Gombe, we are one of the few states. Of course, the challenges of malnutrition is really disturbing there. The numbers are not very encouraging. So I think we actually had, or we are still having intervention from several partners, both at the federal, UNICEF, and some non-governmental organizations. So what we did precisely is at the Ministry of Budget and Economic Planning, well, now that it is a ministry, it was an agency before it was recently upgraded to a ministry. We actually took the driver's seat to bring all the ministries, departments, and agencies of government together to understand that it is not our own. We only coordinate. Of course, the program manager for the accelerated nutrition is a staff of Ministry of Health. So he finds it difficult to report to us. He was reporting to Ministry of Health, which we ignored. We said, that's okay, no problem. We understand that since you are a staff of the ministry, your loyalty should be there. But when it comes to providing the counterpart funding, and this is where we come in. When we come for the quarterly food and nutrition meetings, which we hardly skip, we try to receive brief from the Unrein project, and yes, it's the quarterly meeting actually usually help us in bringing all stakeholders on the table, and it's when we invite them for the meeting that we realize, because we have some partners that are working very hard in the state, and it's when we call for the quarterly meeting that we understand that this is what they do in order to reduce the epidemic, because the first time around 2020, when a presentation was made at the National Economic Council, when the 14th or 15th Emir of Kano was the patron of the issue. In attendance, of course, we went with the governor, and when he rolled out the numbers, we realized that this is massive. But you see, it's very difficult with politicians. They still don't understand the magnitude of the problem. They will always prefer to see graders constructing roads, building bridges, and unknown to them, the issue that they're not addressing will eventually destroy what they are building. So we actually took control at the Ministry of Budget and Economic Planning in terms of coordination, and we, likely enough for us, the permanent secretaries of the ministries that are members of the committee actually. We are lucky that they were very supportive, and we have desk officers in all these ministries. And whenever there is a meeting, they respond. We make as much as possible, try to make the budgetary provision, because since we coordinate, we provide the resources for them. So when we come for the quarterly meeting, we ask them, so what have you achieved? And some will say, no, funds were not released to us. We always tell them that you don't expect funds to come to you, you go to the funds. So try and much as possible to reach out to those those concerned, to support you. Write memos to the governor, even if it's not write him again, because sometimes it's not easy. But when it comes to providing counterpart for all nutrition activities, in fairness, Gombe State tries as much as possible to provide, whether it is the procurement of the RUTF with the UNICEF, whether it is for the Andrin project in Gombe State. We tried as much as possible. And gladly, we still achieve these coordinations from those at the Federal Ministry of Health, Federal Ministry of Agriculture, and even the Federal Ministry of Budget and Economic Planning that are intervening in Gombe. So when they come, their first point of call is the State Ministry of Budget and Economic Planning. And sometimes we have our officers, to follow them to the field. Whatever intervention they are making, we make sure that we receive reports from these officers that have gone out, whether it is the Ministry of Health, whether it is the Ministry of Agriculture, whether it is Ministry of Women Affairs, because they are all supporting Gombe in terms of nutrition issues. So I think being the coordination, hub of the state of nutrition, I think helped us a lot, and we've tried as much as possible. Maybe because I happen to be maybe the longest serving permanent secretary there, so all other permanent secretaries sees me as somebody, when I said, okay, let's do this, they quickly join me to do these things. That has actually assisted in the coordination, because everybody come to see me. Even when you are a director or you're a deputy director, you come to my office for one thing or the other. So now you are a permanent secretary. So when I say, please come, let's have this conversation, hardly they send even a representative. They come themselves for this kind of conversation. So that has also helped us to coordinate nutrition activities. But of course, for the challenges, we've lot of them. I think we will go there.
I will come back to you on those challenges. And thank you for sharing those lessons. I have heard, the coordinative role of leadership, especially by virtue of your office, and even having a patron in the person of an emir.
Yes.
As well.
Yes.
And clearly it played a role in ensuring that people come together.
Absolutely.
Yes. But I will come back on the subject of the counterpart funding, and how that helped the projects that the other partners were bringing to the state. Yes, I will come back to
That's
that.
right.
But yes,
That's okay.
But I'm going to move to Mrs. Bako, because this, the coordinative role, and even the example that you gave at the first instance, the officer that was reporting first to the Ministry of Health, and so those little bottlenecks and how to improve. Mrs. Ladidi, I have been in your office. We have talked about this, the very healthy, long interview that lasted. And you helped me understand even the coordinating structure of nutrition programs in Nigeria. And congratulations on the launch of the micronutrition deficiency report. That is, I know it's been long in waiting, and the insights, have improved, I hope. And it is inching us a little towards the 2025 target? Well, that's left to see. I think my very first question to you is, what are the coordination mechanisms to ensure that nutrition interventions are properly integrated and implemented across sectors? I know that you have a technical working group as the Federal Ministry of Health, but how are you able to communicate and ensure this technical group also is in touch with the Federal Ministry of Agriculture and even the Federal Ministry of Budget and National Planning?
Thank you very much, Sikia. The overarching coordination body for nutrition in the country, as rightly pointed out by the guest speaker, is the National Council of Nutrition, which is chaired by the Vice President, His Excellency. Every other sector takes a tool from the directive that is given by the National Council on Nutrition. So for us in the health sector, we have the National Nutrition Technical Working Group, which is multi-sectoral in nature. We meet every quarter, and what we do when we meet is we talk about what are the priority interventions that the government wants to drive towards improving the nutritional indices for the country across the life cycle. And then we look, who is doing what? Which partner is working where? Because we know that government cannot do it all alone. We in the health sector, we can't do it all alone, so we need the support of partners. So we need to find out who is working where, what are you doing? So we do partners marking. And then but the funds of government cannot be adequate because there are so many conflicting needs. So we also prioritize what we have, and then we fill in the gap. So what some of the things we do in order to ensure that we coordinate effectively is to monitor. We monitor the progress of what the government is doing and also what the partners are doing. And then we give feedback. Every quarter, the partners make a report of what is being done, and we also make a report of what we are doing, and we align. Then we have the annual operational plan. Before 2023, we actually didn't have that, but now we have the annual operational plan. The government, place the plan on the table. Then the partners now plug in what they are doing. So we are speaking with one voice. So it's easier for us to monitor the achievements that we're doing. Then at the state level, we also have the State Committee on Food and Nutrition that is also multi-sectoral in nature. So whatever decision that is being taken, it's transits down to the state and also to the local government level, where we have the local government committee on food and nutrition. So, and then in terms of funding, we have, like I said, we have limited funding, but because of the technical working group, everybody brings in their resources to the table. So it's easier for us to achieve more, because when you put your resources together, you put your strengths together, then we can run faster. And exactly what happens at the federal is what also happens at the subnational level. Then in terms of skill, because we have inadequate human resources providing nutrition services across levels. So the partners support in that area in developing skills. And right now, one thing that the government is doing is developing the skills of providers and volunteers in the provision of maternal, infant, and young child feeding practices. We have trained over 2,000 master trainers in the 36 states and FCT. We had the training within 6 weeks. So, and the partners are now supporting that. They are supporting their focal states to set down the training. And at the quarterly meetings, we get a feedback on this. How far are we going? Where are the gaps? So we are able to channel resources to where the needs are. Then another thing that we've been able to do through the coordination is improving the infrastructure at the facilities for provision of nutrition services. We now have a standard what should be in place when you are in a particular facility in the sense of providing quality nutrition services. And we are using that now to monitor, to see how effectively equipped are our facilities. We identify that. And during the quarterly meetings, we can now showcase where the gaps are, and partners can now, know exactly where to channel their support. Likewise, governments, like in my ministry, in 2023, our budget was less than 100 million. But in 2024, our budget is now in the range of billion. So government is, through the coordination mechanism, government is giving more visibility, more priority to nutrition issues in terms of both the top and also the work. Thank you.
Thank you. That's very good to know. And I hear partner mapping, which helps you to actually allocate resources and has helped you identify, where the gaps and weaknesses are. So I will come back to you to understand if it's just health-related partner mapping or if it is multisectoral in nature. And also, I will come back to you to understand if the PHC service improvement in terms of the nutrition desk is, if it has spread to the 36 states of the Federation or if we're doing it in phases. And I do hear you about the need to, human resource for health is a gap that is affecting completely the health sector. And so when you talk about the dearth of skilled staff strength for nutrition, it's something that I'm sure the health sector reform agenda is working towards addressing, but it is a gap and it is quite obvious. Thank you. I'm coming to you, Malanuhu Kilishi, and I can't even begin to express how important the Ministry of Agriculture and Food Security is to the issue of nutrition, because without food, a number of the interventions that are supposed to improve outcomes would not even be in play or being discussed. So specifically, Malanuhu, I want to understand the costed agricultural sector food security and nutrition strategy, which is from 2016 to 2025, clearly defines coordination mechanisms and integrates 8 food and nutrition priority areas into its plans. So how have these strategies been implemented and domesticated at the sub-national level? That's my question. Thank you.
Thank you, Madam Safia. Actually, 2016 to 2025 would support along with other stakeholders. That document is a very fantastic document because it addresses all the issues holistically. Nutrition sensitive, nutrition specific interventions from production to consumption in the entire value chain. It talks about how production will be made to ensure that we have enhanced diversified nutrient-dense foods, how we are going to have the foods being processed, how the vulnerable groups, women, children, will also process and use these foods at their households level, and then also nutrition information education, very embedded in the document. Now, to answer your question, how it's being implemented, yes. The document was implemented following those 8 strategies, which I have them listed here. For the course of time, I will mention some of them, but I've just gave a summary of them. So we have a lot of programs and initiatives that address the strategy. which has 8 priority areas. Now, the first thing we did was to develop a detailed implementation plan. Now, that plan was implemented at federal level through the National Steering Committee, through the Food Security Committee, National Food Security Committee, then the National Nutrition Technical Committee, which my sister also just mentioned about. And then also at the state level, we have the state level committees that were also being formed. Then there was partnership and collaboration among all the relevant stakeholders to drive some of these programs and initiatives. Now, coming to the domestication, like what the question ended with domestication, you can see that the permanent secretary from Gombe State here has mentioned how the strategy has been implemented using the RM project, the Secretary Resource Nutrition Project. Now, that project was done with taking into consideration some of these states that their level of malnutrition was not too good. So those states were identified, and efforts was made to make sure that we go into these states and have discussions with them and ensure that the project was done and taking care of both health, agriculture, even education in the pilot project. And Gombe did very well because they had a good coordination in terms of the agriculture and also the health, where we demonstrated on the homestead gardening. The women were selected and inputs were given to them, the nutrient-dense food crops, vegetables and crops were given to them to plant. There was also given capacity training on demonstration, how they would grow the gardens. And then also animal protein source was given. They were given small ruminants, goats and livestock. So it was a holistic package. And that project, at least now, we are sure because of the success of that project, we are going to expand the project to cover the entire 36 states of Nigeria in 2024. And we have made budget for that. So this is where we are. Then in terms of the other states, there are some states, they have, because of funding, they are not able to demonstrate the strategy, but I can say it's still work in progress because the states that have demonstrated the project, they have even developed their policies to align with the strategy, like Kaduna State, Kano State, and Gombe State. Other states are still working, and it's work in progress. Thank you.
Malan Nuhu, I appreciate that insight. I am increasingly hearing budget is being available, and in some cases budgets have been increased because funding is actually key to addressing some of the coordination bottlenecks that are being experienced. And that leads me to the next line of question. PAMSEC from Gombe, I really want to come back to the demonstrated results that we have learned from the multisectoral response of ANRIN in Gombe State. Apart from, the success of this pilot, I'm interested in knowing how whether the counterpart funding from the state has been, is part of a legislation, or what is the backing, what the gaps are that you experienced, especially in terms of the communication between the relevant MDAs that played a role in ensuring the success of this multi-sectoral response.
Okay, thank you very much. And yes, let me start with the gaps. Usually when we have transfers of this permanent secretary from this ministry that is a key stakeholder to another ministry, the new PAMSEC, when he comes, we are starting afresh. And we try to, even if he has the handover, I don't know, this has been a very serious issue, and that creates gaps when there are changes at the head, maybe the permanent secretary level of ministries. But for sustainability of the ANRIN project, any any law? No, there is no law. But I think the way we are going about it, officers from various ministries, departments were deployed there, and state every year gives out counterpart funding for the implementation of the Andun project. I think maybe, and of course, it's about, the program is about to close, maybe this year or next year, I can't recall exactly. For now, there is no policy, and there is no law, I mean. But for the policy, yes, government is actually supporting the project, and I think, I don't want to be absolutely sure, but I believe there's going to be sustainability for that, because the support we are receiving, especially from Federal Ministry of Agriculture and Food Security. Currently, as I left Gombe, they were in Gombe, and they are still supporting in this, the goats, the small animals, the homestead garden. They are in Gombe as I'm talking to you now. So, and people have started seeing the impact, and local government, the recently elected local government chairman, have already, we made them to key into this this program, and they are glad. They are saying that, well, this will earn them more vote. So we actually had a meeting with them at the Ministry for Local Government, that this is what the Federal Ministry of Agriculture is doing. Many of them said yes, they know. Only few of them declined knowledge about it. But to be honest, the impact of the homestead garden and this small animal, this thing, the chairman have already keyed in, and they believe, well, maybe, you know, as politicians, you know, when they come to do that, different from how the Federal Ministry, they don't care who you are, whether you are in APGA, PDP or APC, they just get the needed, I mean, persons to support. But whatever, even if he's a poor man, even whatever party he belongs to, I think if that could be done, I think we'll get it right. So I think we've started taking the steps toward the sustainability, bringing the chairman on board to see the good thing. Actually, both the state and the Federal Ministry of Agriculture is doing. Thank you very much.
So I just want to push a little more. So would you say that we need this legislation to be in place in Gombe to actually ensure that this program and the gains are sustained?
No, absolutely. In fact, not even in Gombe. Even at the night, we need laws for food and nutrition. Because if we just stay at policy, the 5-year multi-sectoral plan for the food and nutrition, we need actually, we still are undermining the issue of this food and nutrition. So not even in Gombe, even at the national level, we need it. We need laws that will actually make people to invest and work toward achieving this objective. This is very necessary.
And I'm still going to ask one more. I want you to just help us understand a little more how you were able to just address the communication gap, especially between the agencies, the NDAs that are implementing the multi-sectoral response.
Yeah, as I said earlier on, I almost know everybody in the state service. So it doesn't take me long to just call somebody to come and just have this comment. It would have been maybe different if it were somebody. But being that it is me, and I started there since 1992 as a planning officer, and I grew up to become the director of budget. So when they come for bilateral, I almost knew everyone who usually is involved in this process. So I do not have much problem when I try to, close the gaps. They understand that, okay, since I've been there for long, and when I try to explain, they understand. So I don't actually have that challenge in trying to close the gap for in terms of what we get when there are changes in ministries, departments, and agencies of government.
Thank you, sir. So you need to mentor someone.
No, absolutely.
And you also need to ensure that you transfer this skill of being able to coordinate across. Thank you very much for sharing your insight. Madam Ledidi, I'm coming back to you. I'm happy that you're able to, there's an increase in the allocation that comes to the Department of Nutrition and the strength of being able to map partners working at the state level especially. But just, can you share with us some of the gaps that exist in the current, implementation of some of the nutrition policies, specifically maybe those that apply to the maternal and young child feeding, adolescent health, those that are really closely related to the health sector and in your department?
Thank you, Madam Secretary. The federal, the states, we have different responsibilities. The federal cannot dictate to the states. The federal can only advise the states. So when we develop policies, in order to ensure ownership and in order to ensure acceptability, we develop together in collaboration with the states. It's multi-sectoral approach. And that way you have every zonal representation in the policy. Now, every state, it's now expected to either adapt the policy or adopt. When they adopt, that means they take the policy 100% the way it is. When they're adapting, they pick up the policy and look at it and say, okay, in our own states, this is a priority. B is not a priority. So, in implementation of policies, we have this challenge that some priority issues are not seen as priority issues across the board. But when you look at issues of malnutrition, gone are the days when we say it's only in the north, or it's only in the northeast, or in the northwest. The current statistics on the food and nutrition crisis has shown that it's everywhere. The only difference is that the magnitude differs.
Yeah, numbers.
So, in terms of making resources available, because you cannot implement effectively if you do not have the adequate resources. The guest speaker told us that when we're talking about policy, Nigeria has more than enough policy. But the issue is the implementation. And you cannot implement if you do not have resources. Most times the states depend on the partners to implement. And the partners cannot cover 100% the whole local government in a state. So when a partner is in Niger State, for example, that partner is in maybe 2 local governments in Niger State. And the policy will be implemented in those 2 local governments. What's happened to the remaining local governments? The gap is there. And that's why it's like we're working, we're not seeing so much difference in the statistics. Now we look at issues of human resources. It's not the same as all the states in terms of quality, in terms of quantity, and in terms of mix. The states are at diverse level. So we provide technical support in terms of building capacity of the states. And because of the human resources, and because we know that we cannot have adequate, so there are some volunteers that we equip with
those skills like mobilizing the women, early identification of malnourished child, and now referring to the nearest health facility. And when they get to the health facility, if that facility does not have the services, the facility refer to the nearest center where the facility repair can be obtained. So then in terms of equipment, it also differs from state to state. When we trained last month on the maternal, infant, and young child nutrition feeding practices, we realized that in most health facilities, food demonstration, which is a priority, is not carried out. So the states now are now investing in food demonstration. Yes, we have food insecurity, but there is no locality in Nigeria where you do not have stable food items. The issue we have is poor sensitization, poor knowledge on how we can mix the available local food items to have a nutritious meal on the table. And then, even when, for those few that know how to prepare it adequately. So, to fill that gap of human resources, we are now also looking at building the skills of community volunteers so that they can go into the community and speak to the women and speak to the men. Because it's not just only women that cook. Men also cook. When a woman is breastfeeding, we are encouraging the husband to support her, cook for her. Because breastfeeding is serious work. And if we're encouraging the woman to breastfeed on demand, that means anytime the baby says, she put the breastfeed beside in the mouth of the baby. Then the husband, the father, should also support her in the domestic work. So getting this skill, getting this information, getting this empowerment is across board. So those are some of the things we are doing to ensure that we implement the policies effectively. We bring out the policy, the states implement, and I'm so happy with my permanent secretary. He said something about he knows everybody. So it's easy for him to ask his counterpart for support, to put money in a particular intervention, and they do it. What happens to those that do not have that privileged relationship? So we have to build informal networking. And that's why in the nutrition space, we are, are exposing those at the ends of affairs to leadership skills. Because as a leader, you should identify your network and then have informal relationship with them. Yeah. It is not only when I need a partner to come and support an activity that I pick up my phone and call. No. Once in a while, I just pick up my phone and call and say, oh, Dr. This, how are you? Hope you are good. I just call to say hi. It will take more than 30 seconds. By the time I need that partner service, before I ask, the partner will give it to me. Thank you.
Thank you very much. Thank you. We've already started taking the mentoring classes 101 on how to maintain a healthy stakeholder base. And thank you for sharing some of those very practical lessons in terms of what the ministry is doing to strengthen the sensitization efforts, especially at the community level. Of course, it's being done with Ministry of Education and Women Affairs.
Yes, in health, we don't work alone because getting people to understand how that they need a nutritious meal, they need how to put a nutritious meal on the table involves other sectors. We need water resources because we need to use clean water, safe clean water to prepare that food. We need agric because that food is coming from somewhere. And even the farming should be done in an hygienic way. We need women resources because the women are the ones that will go to the market and buy. It's now we want to say thank you to the men because they are supporting us. So when they go to the market, they need to know how to identify the appropriate healthy food items to buy. We need media because we need to create visibility. Like I said, about 13% of the population are sensitized on appropriate feeding practices. For that percentage to increase, we need to engage the media, both the conventional and the new media, including the town announcers. We need the students because we want to catch them young. Because we realize that once we're able to change behavior, nutritional behavior, then we will get the desired results.
All right.
So we need even the Ministry of Works. We need them because the road to the health facilities where services will be obtained should be well
accessible.
So we need everybody. So the National Nutrition Technical Working Group is multi-sectoral, and it fits into the National Committee on Food and Nutrition at the federal level, and it also fits
Steps
into
down.
the state committee at the state and the local government committee on food and nutrition at the local government level. Thank you.
Thank you, Ma. Malanuhu, I'm coming to you on that note, especially the part about the involvement at the grassroots level. So the strategies that you've spoken about in the agricultural sector plan, how is it being translated at the grassroots level? We've heard the example from Gombe about the small ruminants and the sensitization efforts. How are we translating that? Is it still the sensitization or something else that the Ministry of Agriculture is doing?
Thank you very much. Just like I said earlier on, and also as the Permanent Secretary alluded, from Gombe State, currently our officers are already in Gombe State on the 2024-2025 activity. They are distributing the vegetable seeds, the crop plants, and also the small ruminants to ensure that the target groups, which are the women and youths, are able to understand the value and the importance of eating diversified foods, and they should also produce it locally. So that is being done in 3 local governments in Gombe State, and they are presently in Gombe State. So, and like you also asked, not only in Gombe State, the federal government of Nigeria, under the able leadership of President Bola Ahmed Tinubu, and also under the office of the First Lady, we are embarking on a project that ensures that the 37 states is captured. Each family will grow a garden. We have it in our work plan. So this is why this is the last year of the strategy, and we are not taking it for granted. We are making sure that we have sufficient budget, which we have included in the work plan, to make sure that this year we are able to touch the 36 states, including FCT, making 37. Then also, as part of the strategy to make sure that we're able to implement fully and everybody is carried along, we are engaging the relevant stakeholders. So for instance, in the selected states of our project of the 2024 and 2025, all the private sectors, all development partners are in the room in the discussion. And that is a way to make sure that, like my sister said, the Director of Nutrition and Federal Ministry of Health, nutrition is sectoral, and everybody have to be involved to make sure that we're able to achieve all that we're to do. And we need, like we said, publicity is very important, education is very important. We must make sure that at the grassroots level, the women, the farmer, the old man, everybody in the system knows that you need to eat what is right. And for you to eat what is right, we need it at a local level. We don't have to go and start importing all these foods from outside. We can produce them locally. So the content of the strategy is ensure that we're able to diversify local production of nutrient-dense foods. After it's been produced, then they should also be encouraged to consume it. They should also know how to process and produce. And that's why, like she said, food demonstration is very important. We need to teach the women and the people in the kitchen, both men and women who are also handling food preparation. They should know how to prepare these meals so that we're able to have adequate nutrition. Then again, we're not only relying on our appropriation, the federal government appropriation of yearly plans. We also have, in this last leg, we are utilizing our donor funding from ARIN to ensure that we're able to complete and cascade all the things to all the necessary local government areas that we are covering. Then, going forward, we're going to use innovative agriculture, that's digital agriculture, to make sure that we're able to carry along most of the things that we do. For instance, we need to use irrigation agriculture. When we enter dry season, now we have to make more efforts to make sure that during the dry season, we're able to produce all the staple crops that we need through irrigation. Then we're also developing a concept on urban and peri-urban agriculture, which is very critical, so that people can use the available resources they have and land to farm, in view of the fact that we have security challenges now, which is not encouraging. People are not able to go to farm. So whatever situation they have, whatever environment they have, they should be able to use it to produce something. Thank you.
Thank you very much, Malanu. I would love to go around again with more questions, but I'm mindful that we have a room full of participants who also want to engage with our panelists. So I'd like to use this next 10 minutes to actually take questions from the room, from our participants. So is our mic handy so that we can take a few questions from our participants?
Can I go?
Yes, please.
Oh, okay. All right. Thanks to the panelists for these very robust conversations. My name is Chidera Chukwu. I'm the health advisor with the Foreign Commonwealth and Development Office. So I have a comment and a question. So to my comment, 6 days ago, a few days ago, at the 144th National Economic Council meeting, we had the Vice President pronounce the endorsement of the Food and Nutrition Security Task Force, as well as the Nutrition 774 grassroots movement to combat nutrition. And what that means is that at this point we have the political commitment that we have been seeking for in terms of nutrition, and there is the appetite, right, to prioritize and improve the profile of nutrition issues at the highest level. So, the National Economic Council is chaired by the VP, as well as the Nutrition Council on Nutrition. So nutrition actually has a front door access into national economic discussions. So at this point, I'm not sure we should be wailing, rather we should be organizing on how best to ride this momentum, this wave of momentum of political will at the highest level. And this is where I sort of agree with Mr. Jallo, regarding having laws that helps to entrench some of the gains we've made, the structural gains. Because the next government can come in and decide that, we will have a different person as the lead of the National Council on Nutrition. So that's really important. So my question, of course, is to any of the panelists around how can we coordinate better, how can we take advantage of this momentum, in political will at the highest level to ensure that we have better nutrition outcomes in Nigeria. Thank you.
Okay, thank you very much. Very beautiful presentations. My name is Gospel Precious. I'm a pharmacist. Before now, I used to work in community pharmacy, where, as we know, many of our people come to for any slight ailments they notice, be it from children, mothers, and all that. So the comment I want to make is this. The truth of the matter is that the fueling of the malnutrition we have today has a lot to do with the recent economic situations. Many people cannot afford the basic staple foods we have in this country anymore. That is the truth. I am talking rice, I am talking yam, I'm talking beans, all those things that people typically eat every day in this country are almost unaffordable. And we can speak all the English we speak here. If people do not have the resources to procure these things, they simply cannot get the nutrition they need. That's the truth of the matter. And thankfully, we have somebody from the Ministry of Agriculture here and also from the Ministry of Health. So let me just go to the questions because of time. So, sir, from the Ministry of Agriculture, how are you people, working to ensure that farmers can return back to the farm and then produce these foods? I know there is the question of insecurity. I don't know if you can also respond to that. Is making farmers not to go to the farms. And then to see how we can now make some of these food items affordable. What role are you and your ministry playing in that regard? And Mrs. Bako in the Ministry of Health. So my question is this to you, quickly. And how are you people in your ministry collaborating with you in your side of the ministry, collaborating with the people in the food and drugs, and as well reaching out to the people in the Association of Community Pharmacists of Nigeria, ACPN, who are the people in the pharmacies, and of course the people, the patent medicine vendors. As we know, nutrition is not just about food. There's also a drug angle to it to manage malnutrition and things like that. The collaboration in that area. Thank you.
Okay, thank you, our panelists. And if I'm asking a question or making a comment, just know now that Mrs. Nelson is now on the other side. That I can ask you any question. I want to start with the PS, Mr. Jallo. And when you are speaking, you talked about, on the RN project, on the issue of sustainability of the RN project. And I heard you say, you're not sure of the sustainability. And I want to say that this period is a budget cycle period that is now time for Gombe State to know what they can do to scale up and to sustain the project. You've done so well, Gombe State has done so well in paying their counterpart funds for the RM project, and it will be good that the project continues. The project is ending in December, and please, it will not be good. You've been there as the permanent secretary. Let it not die at the end of this year, 2025. And Mrs. Bako, all of them MNI. Yes, you've gone to the prestigious school in Jos. Yes, the budget for the Ministry of Health has been increased for this 2024, and we are all happy. And this is September. I don't know how many percentage of this 2-point-something billion has been released for implementation. It will help us so that when we say government has done well, we continue to applaud them and applaud them to the end. And Mr. Kilishi, I don't know whether it's out of context. You are talking about the RM project, but I heard you say something that families will be reached with homestead, with gardening. I don't know whether those of us in the urban area, the urban poor, whether we are part of it. Are you talking specifically about the projects going on in Gombe State? Thank you.
Any more questions?
We have 2 more questions, but after that, we're moving to the online participants.
Thank you, everyone. Hello, and thank you to our panelists so far. My name is Elizabeth. I'm representing MDoc Healthcare, and we're a digital health organization that's providing support for self-care support for persons that are living with chronic health conditions. And one of the projects we're implementing specifically in the Southwest is addressing nutritional vulnerability, particularly for pregnant women, women of reproductive age. And we are doing this with an innovative gardening solution. So I was really excited to hear about the home gardening initiative that's been piloted, particularly in Gombe State. I even have a sample of the what we call gardening in a box, so like vegetable seeds that we can give women to plant, and can feed like a family of 4 in a month. So my question really is understanding how can we get this to, how can we partner, how can we get in the rooms where these conversations are happening so that we can reach more women. We're currently implementing in Lagos, Ekiti State, but it will be helpful to understand how can we get more women to benefit from this, and also just understanding the plan for scaling, so scalability, sustainability. We don't just want these conversations to happen. I'm hearing a lot about the timelines, 2025, but want to see how we can actually address this nutritional vulnerability, improve the outcomes, particularly for vulnerable groups like women and children. Thank you so much.
I want to say thank you to all the panelists, and I say actually this is a beautiful conversation that we have. My question goes to Alaji Jallo from Gombe State. Coordination has actually been a bottleneck in this space, and you've done a great work there. And Gombe is one state out of 36 that we have, plus Abuja. What template will you recommend to other states to follow in order to ensure effective and efficient coordination within nutrition sectors in their state, especially using your counterparts as chairs of State Committee on Food and Nutrition in their states? So I want to hear few steps that you recommend that any step can adopt to ensure effective and efficient coordination within the sector in their state. Thank you.
Thank you very much. Let's take these questions before we go to the ones that are online. And Permanent Secretary Gombe, I'll start with you. If you would just respond to the questions that I directed at you. And then the very last one is to you.
Okay. Yeah, with Madam. Not sure doesn't mean that the project, or the program of ANRIN will cease to exist. What I mean, not sure whether the structure of the World Bank structure of the ANRIN project, that is what I actually mean. But obviously, as we are aware, it is a multi-sectoral, and it might be there in various ministries, departments, and agencies, not as a project as it is set up by the World Bank. So, of course, the idea, the project, the concept will surely continue. This I'm very sure of. The only thing that I wasn't sure whether the same structure, the World Bank structure, as it is, whether it will continue or not. My sister there is talking about where we're going to partner. I'm here, she's here, so we're going to partner. I'm very sure. We will see how we can discuss further, maybe during or after this this program. But the template precisely that the last guy was talking about, whether we're going to share with other states on the political will of the state, so that they can also leverage on the successes Gombe State has made. I think there are a lot of differences in the states. It's a matter of priority. Some states listen to, experts who talk to them. As I was saying, in 2020, there was the National Economic Council when Lamido Sunusi made a presentation on the level of this nutrition problem in the country. Okowa, the governor of then Delta State, was the first person to say it. He's a medical doctor, but he doesn't know that this thing is that serious. Because when the presentation was made, you can see him taking notes. And his first comment is, honestly, he's scared. So it is a matter of commitment from the political leaders to see that this is actually an issue. And most often times, they have been briefed at the Governors Forum. And the Governors Forum, these are some of the key issues. Either World Bank or experts are invited to brief them that this is a problem. So it all depends on whether the governor sees it as really a problem. He will take it up. But a specific template, honestly speaking, I'm not sure if there is going to be a specific template for other states because they're being informed on regular basis at their own forum. Thank you very much.
But just a comment. The question around how do we take advantage, or maybe Malon, who you respond to that, because it seems it's directed at food security.
When you finish answering.
Okay, so let me allow you, Palmsec, let Malon who respond to that specifically.
No, I think those that have taken note of the question that are
Directed
to
at you.
me, I think, I don't know whether I've missed some, but I think
Yes,
if I really missed, let me just, my attention should be,
no problem. You addressed them.
yeah,
Yeah,
sure.
all right. Thank you. Malon, please.
Okay, thank you very much, Mr. Chukwuchidara. I am so pleased with that, your comment, because there's no doubt about it that the current leadership, especially with the office of the Vice President anchoring the National Council of Nutrition and his commitment and passion for making sure that we do not have malnourished people in Nigeria, and with the launching of the N77 project to be done any moment from now, I quite agree with you that we need to have enabling laws that will ensure that these things will continue. But I'm not a lawyer, so I'll not be able to tell you the process and procedures. But what we'll do is that in our next, this is why engagements like this are very important. In our next meeting, we'll take it that definitely, since we have political will, there's a need for us to have, in addition to the policies that we have, because already now we have fantastic policies and strategies to address nutrition issues in Nigeria. It's just the implementation and the coordination that we have noticed one or two gaps. And definitely, government is a continuous activity. So these gaps will be addressed as it's been noticed, and coordination will be strengthened. So we will now take it as a follow-up action to ensure that we're able to come up with appropriate strategy to get the legislation that will address the comment that you raised. Thank you very much. Then the questions that were specifically addressed to me, there were two. The first one has to do with from my sister who has just retired from service. We very much appreciate her. She's also a very fantastic person in terms of nutrition. She was the one heading the coordination unit of nutrition in the Federal Ministry of Budget and Economic Planning. Thank you for that question. Actually, he has made a clarification, but I need to add more. The RM project is specifically in Gombe State as a pilot project. Now, what we're saying is that that project has been accepted by the Federal Ministry of Agriculture and Food Security and by implication by the Federal Government of Nigeria. We are going to upscale that project into the 36 states of Nigeria and FCT. And it's now going to be every family has a home garden. Every home or family has a garden. And I tell you very clear, we have a budget line. It's in our work plan, and we have budget for that activity. So in addition, again, every family has a garden or home has a garden. It's going to be in the same format that is with the RN project, because the RN project has been tested and has been found to be very useful and successful. We have learned from the last RN results conference we did 2 weeks ago, some of the challenges and gaps we have noticed. So we're going to use lessons learned to improve and make sure that 2024, this project that I want to run into the states will take care of all those anomalies. So then also, the N774 project is also another project that has in it homestead gardening and household gardening that will be launched and will be done at the 74 local governments of Nigeria, and also the state governors are in the buy-in. Then another question that came to me was the one from my brother here on the rising food costs, which he linked it up with the security challenges. Yes, there's no doubt about it. The major issue we have is because the prices of foods are high, so definitely if the accessibility and affordability is not there, then definitely one will be affected by the cost. But again, security. How do we address farmers getting back to the field? This has always been discussed in several fora, but the government is not folding her arms. A lot of actions are ongoing, but from my ministry, I know that we have engaged agro-rangers. We have discussed with the agro-rangers and also with the security outfit on how to ensure that farmers' fields are being protected. The only thing is that once in a while, we hear comments that are not too good in terms of the way the insurgents and the bandits are forcing farmers out of the fields and even levying them before they're able to either farm or even harvest what they have labored for. Then the last comment was on, okay, I've answered that one, coordinating better to ensure that we have good answers. I've already answered one. Thank you so much. These are my comments.
Thank you very much, Malanuhu. Madam Ladidi, it's over to you.
Thank you very much. I would also like to add a few things to the questions that was asked by Dr. Chidera in terms of how do we strengthen coordination, looking at what just happened at the NEC. One thing we're going to do is to be more transparent in the dealings with the stakeholders. We're going to ensure that we put in place an accountability framework. Already the Nutrition Core Working Group, we have started that discussion. And we are also going to strengthen the monitoring and evaluation system that we have. We're going to make it more effective, integrated, so that we are all, using the same scale, so it's easy for us to monitor our progress. Then we're also going to strengthen communication between all stakeholders. Like the National Technical Working Group that meets every quarter, will ensure we meet, and the National Council on Nutrition, and even at the subnational level, the frequency of meeting will ensure that we adhere to it. And if the need be, when there are emergencies that the platform needs to meet more, we ensure we do that. And also, we will also prioritize sharing of best practices so as to learn from each other and also strengthen the coordination. And then regarding to the 774 initiative, one package that is going to be in that 774 initiative is establishment of community nutrition center, where in every community you can walk into that center and you will get appropriate information on healthy eating practices, where it can be demonstrated to you. You can come and ask questions, and it will be community driven, community owned, So that's some of the things that we are, going to pay attention to. Then the question that was asked by retired but not tired Mrs. Nelson. I can't actually give you a specific figure, but I'll tell you one thing. There is no request that will be put forward that we have not gotten the funding and that we have not gotten and that we have not implemented. One example is the breastfeeding initiative. We have gone to 4 zones, empowering the stakeholders across sector on early initiation, exclusive breastfeeding, and breastfeeding in addition to complementary feeds from 6 months up to 2 years and beyond, sponsored by government. So, but by December, if you ask me that question again, I'll be able to give you a figure. Now,
Food and drug community.
food and drug, yes. The coordination platform that we have, it's multi-sectorial. Food and drug, we have the Food and Drug Agency, and we have the Food and Drug Department in the ministry. We are active members of the National Nutrition Technical Working Group. The agencies, the associations, they are all members. Likewise, at the subnational level, the State Committee on Food and Nutrition and Local Government Committee on Food and Nutrition. At the local government level, the patent medicine sellers are members of that committee. So all the coordination platforms that we have are multi-sectorial in nature. And my sister that was asking, how will you integrate? Please, the door is open. Join us, just make sure we have your contact, and we will invite you to our coordination meeting. And if you are not based in Lagos, wherever state you are based in, just walk up to the State Ministry of Health and ask for the State Nutrition Officer, and you will get enlisted into the coordination platform. Thank you.
Thank you, Aditi. Are the questions from our online participants ready? We need to double up on our time. Ooh, okay. Right. Okay. So I'll just read it and try to identify who the question is for. So the very first one here is there anything specific you would like? Oh, that's not a question. Okay. Nuhu, this is for you.
Okay.
What have been some of the key successes and especially challenges in getting buy-in to the agricultural sector food security and nutrition strategy from the state governments? That's for you. That's the very first question.
Okay, thank you very much for that amazing question. Yeah, from the states government, most of the states, they are very interested in the strategy because, like you know, federal government does not own land. Lands are in the states, and farming takes place in the state and local government. So at the onset of the launch of the strategy, we try as much as possible to carry along the states. My brother is here, he's from the state, he knows the efforts that we have made. So the major challenge in the discussion is that some of the states are still trying to understand the strategy. So the major challenge is clarity of understanding the document and also the capacity of the personnel in some of the states to implement the 8 priority areas as itemized.
Is at the end of affairs, find out the existing coordination platform, enlist onto the platform, be active in the platform so that you will know what is being done, and then you can identify where you can come in, how you can participate actively in the platform. The nutrition structures at all levels, it's open to CSOs because with you working with us, we are assured that we have somebody that is checkmating us, we have a structure that is monitoring how well are we doing. And even when we're not doing well, we want the CSOs to tell us so that we can know our gaps and now, correct it and do the needful. Because the ultimate goal is to provide quality.
My key take the leadership and coordination structure at the subnational level. Clearly, more needs to be done for our implementing MDAs to understand the structure and who does what, the specific roles, and the collaborative nature of this multi-sectoral and sustained investment for the gains that we are beginning to see by the pilot that happened in or is ongoing in Gombe and in some other states. Also, questions. And so I want to thank you. National planning arrived, and we're going to make a space for him after this session for him to address us, because we need to hear from the coordinating body what is going on in this multi-sectoral response. So I'll invite us to stand and take a picture for the records. Thank you. Join our picture.
Yeah.
Sorry, sir.
Thank you very much, all. I'm sure we have all taken a lot from this particular conversation. These were very salient points and wholesome conversations that have transpired here today, and this is just the first panel. So at this point, I'd like to invite Dr. Vitalis Emeka Obi, MNI, who is the Permanent Secretary, Ministry of Budget and Economic Planning, and also the Chairman of the National Committee on Food and Nutrition, for his address. Thank you very much, sir. Great to have you, sir.
Your Excellencies, distinguished ladies and gentlemen, I wish to stand on existing protocols. Please permit me that I came in behind the scheduled time. As a Federal Permanent Secretary, I don't own my time again. So I was actually also chairing another meeting on UN Women, strengthening UN Women empowerment program for affirmative procurement in Nigeria. And immediately I finished my part in that session, I started racing down here. So please, I know I will have your pardon, please. Thank you so much. I listened with rapt attention to the panelists, and the questions actually did follow. I was happy with the questions because they spoke straight to power, they spoke straight to my mind, they were quite incisive, and they also interrogated the way forward, especially the political will and backing to be able to attain goals, especially in the forthcoming year, 2025 fiscal year. But I'll just make a brief few remarks so that you would know our stand and where we are coming from the Federal Ministry of Budget and Economic Planning. As the Permanent Secretary of the Federal Ministry of Budget and Economic Planning, in addition to being the chairman of the Council on Nutrition as well, I have two additional roles. I'm also secretary to the National Economic Council, and I'm also secretary, I think, to the National Council on Nutrition. So I think it's a square peg in a square hole. I am speaking to two ends on what you're talking about. I was at the neck, I felt, was that she said achieve. Ministries of Budget and Economic Planning. they also help us to coordinate at sub-national level the policies and programs and projects that we have initiated at the national level. Multi-sectoral coordination. 2, the challenges that are really involved. 3 points rather, and the third one has to do with the opportunities that do exist. So let me start by appreciating the organizers of this event for putting up these discussions really on improving nutrition coordination in Nigeria. My ministry, in line with its statutory mandates, coordinates the implementation of food and nutrition-related interventions in the country. Addressing malnutrition remains one of our cardinal objectives on food and nutrition, which is shared by myself, and at the same time and at the subnational levels to streamline these policies and programs initiatives. Now, a landmark achievement in this regard was the development of the National Nutrition Dashboard, and this we achieved through the support of the World Bank ARIM project. World Bank ARIM project is what we're giving a lot of muscle behind it to ensure that it completes, it really has a good run in its program implements. They should work so that the project did perform very well. This will make the World Bank know that the host country, Nigeria, has been very responsive and done very well with respect to ARIM project, and that will also make the project be partners really. They do not with the coordination on nutrition included lack of integration and insufficient alignment between various nutritional programs and policies across the country. There's also conflict of interest in the terms of mandate, and we are appealing that people should get their lines straight so that there'll be no conflict of interest at all. Now, it has also been brought to my notice as a challenge that there's a non-existence of departments and budget line for nutrition programs in major MDAs due to insufficient political will. Where budget lines do exist, some are inadequately funded at national and sub-national levels. We'll take care of that. Limited resources to our funding, which are interrelated, lead to competition among sectors rather than cooperation. There are also weak data systems, inconsistent and inadequate as they are, there's weak monitoring and evaluation systems, and this makes it a challenge to track progress and also determine the outcomes of multi-sectoral interventions, limiting the accountability. Now, approaches are also noted to be fragmented but not united. This fragmented approach, it just limits the capacity of MDAs to really implement at their own levels. Also, very few personnel do exist in nutritional divisions and departments across the country. Also, non-disclosure of information across, especially with respect to finances, plans, and achievement by the development partners, and sometimes MDAs who are the implementing arms of it. Also, we also noted that communication gaps have existed and sometimes do newly come up along the line, and these communication gaps result into, and this affects also the result that we're also looking for. And the final one has to do with opportunities. Now, this is very key and important to us as a ministry in our coordinating role. Now, the National Policy on Food and Nutrition, which is coordinated by the Federal Ministry of Budget and Economic Planning, provides ample opportunity for the implementation of the National Multi-Sectoral Plan of Action for Food and Nutrition. Now, this stresses the use of a this council is chaired by the Vice President, His Excellency Senator Kashim Shettima. I am the Secretary. This council has personally taken the lead on advocacy on nutrition. The issues with nutrition and with relevant to, being relevant to state governors and policymakers and faith-based leaders for awareness on malnutrition and increased commitment to nutrition. So this opportunity, I feel that yes, we should use that leeway where we have access to the governors at sub-national level from the National Council to drive. Luckily, governors are into two forums. One, Economic Council, and also the Governors Forum. At the Economic Council, when it's brought up, the governors buy into it and they take it back to the states and they devolve it. The commissioners drive the implementation plan there, and then we also get to see the results that can bring back to the council. National Council too, we also use the subnationals to also drive it. So this is an opportunity that we'll keep on exploring. Third opportunity has to do with partnering with international organizations, our international development partners. These partners do provide technical and funding support where they are able to. Now, since nutrition is on the front burner of government priorities, we want to drive that. deepen our partnership with the international partners to ensure that they keep on providing adequate technical and funding support to our cause. The last one is there is need for us to explore the opportunity of strengthening collaboration among stakeholders. This will align our policies, it will improve our systems of data gathering and analysis and compilation, and it also foster political commitment. It will engender it and strengthen it to enhance food and nutritional outcomes in Nigeria. Overall goal, it will address all the multi-sectoral coordination challenges we have experienced in the past. Overall, or in conclusion rather, I would want to end by saying that strengthening our multi-sectoral collaboration among stakeholders, as I said, aligning these policies, improving data systems, fostering the political commitment, all together will help address issues of food and nutrition for improved nutrition outcomes in Nigeria. At the end, on our own end as a ministry, we would keep on taking the role of coordinating these policies, programs, and projects, and get the other MDs who are the implementing ministry department agencies to go ahead, after we've coordinated them and empowered them to go ahead to implement both at national and subnational level to achieve the overall goal. So suffice it to say that the issue of nutrition, really, like Chidera spoke, I think I took note of that, has really gained national prominence now. And with the passage of the N774 at the council meeting, I was present at that council meeting when we adopted it, after it was presented. It has now given us the impetus to be able to drive to a logical conclusion. And so at the national level, we do our best to support and also provide adequate budgeted timelines to the cause of nutrition at national space. We also want
Thank you, ladies and gentlemen. Can we all start making our way back in for the second segment, please? We are already pressed for time or behind schedule as is. So to usher us into the second segment, I will be inviting Nimad Hajiboy, who is the Chief of Nutrition at UNICEF Nigeria, to give her keynote address. Please, round of applause for her as she takes the stage. Thank you very much.
Good afternoon, everybody. That's very weak. You'll have all had tea break. So I need strong, as they say, use your campaign voice. So good afternoon, everyone. Great, thank you. I apologize for not being available this morning as per the schedule. But as you all know, this is a busy time for us. And given the floods that happened in Borno State yesterday, I was pulled into some meetings for that, so couldn't make it in the morning. And I do want to say that our sympathies are with all the people affected in Borno State as we speak and meet today. What I was asked to speak on is fostering a shared understanding to enable better coordination and change the nutrition narrative in Nigeria. I'm going to start by making a few points to set the context and the background, and then end my address by highlighting what I think are some key actions that we can take. So first, and I think many of you who've heard me speak before know I always lead with this. While Nigeria is the giant of Africa in many ways and is a bubbling, vibrant country, we are sadly also the giant of Africa in terms of numbers of children malnourished. So we are ranked 1 in Africa and 2nd in the world in terms of the number of malnourished children we have, that is children under 5. For those of you who know, we have about 35 to 40 million children under 5 in the country. At any given point in time, 13 million of those are said to be stunted, which is they are short in terms of their height for their age. 3 million are suffering from wasting, which means they're too thin for their height. And about 25 to 27 million children are anemic, which means they won't have the energy to play, to learn, and to do things. These statistics are extremely disturbing. But on the other hand, they are statistics that can be changed. And they're statistics that can be changed by coordinated and harmonized action. Sadly, these statistics also put us in a place where Nigeria is currently off track, as we say, to achieve the 2025 World Health Assembly targets and the 2030 Sustainable Development Goal nutrition targets. So if we want to show that Nigeria can do it, the time is now. 2025 is less than 6 months away, and 2030 is about 5 years away or 6 years away. So there is a sense of urgency and a need for us to come together if we want to change this narrative for Nigeria. And many of you in this room, I would say especially those of you from the media, have a big role to play in advocating and communicating about the change that we need to see. So, what do we mean by shared understanding? I'm going to make about 5 points on this. The first point I'm going to make is that we hear the term multi-sector. Nutrition is a multi-sectoral issue. It's multi-sectoral. But to me, that's a term. And I believe we all need to fully understand, fully adopt what is meant by that term. And that term actually means that nutrition is like an orphan. It is everybody's business and yet in some ways nobody's business. So no one agency, no one department, no one ministry is held accountable for nutrition. So we really need to make sure that that coordination happens so that across each ministry, department, agency, we understand who is responsible for nutrition actions, for nutrition financing, for nutrition data, so we can come together. Now, while that is the truth, the good piece in Nigeria is the fact that we have an excellent coordination structure in place. So that is my second point. We have a structure starting right from the Office of the Vice President, which is the National Council for Nutrition, chaired by His Excellency the Vice President. It brings together different stakeholders on a biannual basis to discuss where we should be heading. And that coordination structure, let me tell you, doesn't exist in most countries. You don't have nutrition sitting at such a high level, and we need to be able to leverage it. We then have a ministry here, and you heard the PERMSEC from the Ministry of Budget and Economic Planning speak. And they are responsible for coordinating across different MDAs nutrition work. And they are mandated to do so. So this is also good, because in many other countries we struggle and say, should nutrition be coordinated by health? Should it be coordinated by agriculture? Should it be coordinated by social protection? Where should it lie? But here we have a designated ministry that can coordinate all the other actors. Under the Ministry of Budget and Planning, we have the National Committee for Food and Nutrition, and that meets at least 4 times a year. We then have the same committee at the state level, and now we are saying we need to push down to the LGA level. So we have a fabulous coordination mechanism in place. What we need to do is make it stronger and use it optimally. The next point I'm going to make, and this is my third point, so the first one was multi-sector coordination is a must. The second point is we have the structure in place to promote coordination. We need to leverage it well. The third piece is let's not coordinate for the sake of coordinating, and let's not just coordinate on issues that I believe or feel is important. A few months ago, when the National Food Consumption and Micronutrient Survey was launched, the Honorable Coordinating Minister for Health and Social Welfare said, this will help us to have evidence-informed policy, this data, and not opinion-informed policy. So that's the same with coordination. Let us use data that we have to inform how we coordinate. Not, oh, NEMA thinks we should coordinate, so let's coordinate. It is not about my opinion, but what the data says. I also want to quote an ex-UN Secretary General, Kofi Annan. He said, without data, we are flying blind. So if we want effective coordination, we need to strengthen our data systems, whether it's the health data system for nutrition, the agriculture data system, the social protection, or the WASH. We need good data to tell us where we are doing well and where the gaps are. The next thing I would say, and I want everybody to go away, it's a funny acronym, but it's called PIS, P-I-S. And what does that stand for? So again, if we are coordinating, it's not coordinating to do everything under the sun. We don't have the bandwidth, we don't have the money, we don't have the human resources. But if we can focus our efforts on P, which is prevent or prevention, we need to prevent our children and mothers from being malnourished. That is really the best thing that we can do. We can scale up, so we need to focus on prevention. We need to focus on integration because, like I said, nutrition sits across multiple sectors. So while we can coordinate, we also need to integrate and use platforms to deliver multiple interventions. And the last piece of the PIS acronym is scale. Nigeria has 36 states and FCT, right? How many LGAs in Nigeria? 774. How many wards in Nigeria? Nobody knows. Roughly around 8,000. You multiply 774 by 10, roughly. So roughly around 8,000 wards. So if we only work in 100 wards, will that be sufficient to drive change? No. Well, if I work in 200 of the 8,000 wards, will that drive change? No. So we need to make sure that we are delivering these high-impact preventive interventions at scale. That means 60, 70, 80% of wards must be delivering high-quality nutrition interventions. That is what we need to change. And to do that, we heard the PERMSEC of Budget and Planning saying that sometimes there is overlap, sometimes there is duplication. But if we harmonize our efforts, then we can avoid that. And I can say, okay, I will work in wards 1 to 10, and you will work in wards 11 to 20. So we can divide and conquer really strongly and scale the interventions. The last piece about coordination and sharing understanding is, can anyone guess what it is? It's a very important thing. We cannot live without it. Huh? Funding, right. So money, financing. And we're saying we need to come together and coordinate and harmonize our advocacy to do two things. So it is about funding. We do need more money for nutrition. But remember, just like I'm saying we need more money for nutrition, my counterpart who works on immunization is saying the same, and somebody who's working on water is saying the same. So yes, we need more investments, more funding for nutrition, but as nutrition actors, we also need to ensure that we get better nutrition for the money. What does that mean? It means that if I have 1,000 naira to invest, I should invest it in the most impactful intervention, because I cannot do everything. So I need to prioritize. And we are very lucky. The Nutrition Core Working Committee that informs and works with the National Council for Nutrition has come up with a 10-point agenda to say this is what we need to scale across health, this is what we need to scale across the food system, this is what we need to scale across social protection, this is what we need to scale across WASH. So we need to do both these things, take that 10-point agenda and really drive scale. I think you heard the PERMSEC also talk about the N774, right? So that is the platform, a grassroots build up to drive scale. But again, N774 cannot be that one LGA in the north does something and then one LGA in the south does something else. We won't see change. Yes, the context may be different, so you adapt and contextualize, but we need to come together. So all I'm saying is there are 5 big things that we can do to change the narrative for nutrition in Nigeria, and I'll repeat those. The first is recognition that nutrition is multi-sectoral and that we do need to coordinate strongly across all the MDAs. The coordination cannot happen in a vacuum. It must be data-driven or evidence-informed. The coordination must drive preventive, high-impact prevention services. It must integrate with other sectors and must be at scale. And I forgot to say earlier that yes, while the aim is to prevent malnutrition, sometimes, unfortunately, due to many reasons, a child may get acutely malnourished. And in that case, we have to ensure that that child has access to treatment. So our tagline is prevention first. Where prevention fails, treatment is a must. Because without that, children will die. The next thing, as I spoke about, and last but not the least, was financing. And without the financing, we can't do much. So these are I want you to go away from my keynote speech with 3 mantras. Can you all do this? So the first mantra is prevention first, and where prevention fails, treatment is a must. Can you all say it? Fails? Treatment is a must. So that's the first mantra. In India, a mantra is something you chant every day to remind you. The second mantra that I want us to go away with is to say, prevent, integrate, scale. Can you say it? And loudly this time. And then the last mantra I want you to go away with is to say more money for nutrition and more nutrition for the money. And this loudly, as loud as you can. You've had tea break now. So can we say it loudly? More. Excellent. So I want to end by saying if we can achieve these three mantras collectively in a coordinated way, in a data-informed way, with the resources we need, financial and human, then we can change the narrative and make Nigeria move from the giant of Africa that has the most number of malnourished children to the giant of Africa that has the most number of healthy children and well-nourished children. So that is the vision, and that is what I would like to leave you with. Thank you very much.
Another round of applause for her, please. Thank you. So you've heard it here. Heard it here first, folks. Prevention, integration, and skill. PIS. You know, that's very easy to remember. So I think after this particular address, I'm going to call on Oloma Omeje, who is the program manager at Nigeria Health Watch, to introduce the panelists for our second panel. Round of applause for her, please.
Good evening, everyone. Hello. Okay, just making sure we are still in the room. Welcome to the second panel discussion. It's themed Exploring Strategies for Deploying Complementary Approaches for Nutrition Coordination in Nigeria. Earlier discussions, even the presentation earlier, and the speeches and addresses have highlighted some of the coordination gaps we have in Nigeria as it relates to nutrition. Not to bore us with the list, some of them is the fragmentation of interventions, also having inadequate multisectorial coordination, just to mention a few, and this also impacts and leads to duplication of efforts and all of that. We all know, you can agree with me, that nutrition is a cornerstone for health and development. For a country like Nigeria, like Nimat said, there is need for efforts, for coordinated efforts between stakeholders, all the stakeholders. So for this panel, essentially, we'll be exploring strategies for deploying complementary approaches in nutrition coordination. And at the end, we'll come up with actionable recommendations that can be deployed for better coordination. For this panel, we're very fortunate to have expert panel that will share insights on how they ensure nutrition is adequately coordinated at both the national level and subnational levels. So allow me to welcome our panelists to the stage. And first on the panel, we have Mrs. Chito Nelson. She's the former head of nutrition at the Ministry of Budget and Economic Planning. A round of applause, please, for her. She's now an independent consultant on nutrition. So our second panelist is Linian Okafor. She's the communications officer at the Civil Society Scaling Up Nutrition in Nigeria. Sorry. And then third panelist we have. The top panelists we have Aisha Hadejia. I really hope that I pronounced that right. She's a partner at Sahel Consulting Nigeria. And finally, on the panel, we have the fourth panelist that will be joining us virtually. Dr. Osita Okonkwo, the Country Director for Nutrition International Nigeria. He'll be joining us virtually. We'll get to meet him as we go along. All right. So earlier I had said that what this panel is about is basically exploring strategies for deploying complementary approaches in nutrition coordination in Nigeria. So let's dive right in. I'll start with Mrs. Chito here, who is the former head of nutrition. Who is the former head of nutrition at the Ministry of Budget and Economic Planning. I'm now functioning as an independent consultant. So, Mrs. Chito, from your experience, right, as a former head of nutrition, what have been the main challenges? And this is stemming from earlier conversations that we have had. So, what are the main challenges in reducing fragmentation and ensuring synergy between donor-funded nutrition programs and Nigeria's national priorities?
Okay. Yeah, thank you. Good afternoon, everyone. I will start by saying that the donor-funded priorities aligns so very well with the country's priorities, but there are bounds. We have challenges. Can you hear me?
No. Yes.
Okay. Okay, can I repeat myself? I said that donor-funded priorities aligns very well with the nutrition agenda of the country. There's no donor so far that is working against the national policy on food and nutrition. That said, we've observed that there are a lot of fragmentation, and we need to ensure that donors work in synergy. But for donors to do this, some of these challenges need to be addressed. We saw the Permanent Secretary, Federal Minister of Budget and Economic Planning here. Leadership and coordination is very key. When we have a very strong leadership and coordination, the issues of fragmentations will be reduced drastically. And this PS has proven that, and he's showing a lot of political commitment, and that is very good. The first time I met with him, I said, sir, please, if there's anything you can do for us, ensure that you attend nutrition forums. And this he has done. And going forward, I believe he's going to do better. Because there are some permanent secretaries, they'll be there throughout their tenure. There won't be any single thing on nutrition they will attend. But he has shown leadership. So this is very important for us. And a lot has been said about coordination and leadership at the highest level. And like he said, there are a lot of duplications going on. And when there's a lot of this duplication can only be addressed when we have a very strong leadership. The Ministry of Budget and Economic Planning at the federal level and at the state level, they are in position to ensure that this fragmentation does not happen. But like he said, and what we have on ground, we don't have the list of these donors working in Nigeria. We've tried to map them, and some of them became very elusive, that we've not succeeded in getting them. And for us to get them, you need to register. You register with the Federal Ministry of Budget and Economic Planning, but most of them, once they register as CSC, they run into the states and start working. And the fact that when they get to the states allow them, they won't ask, have you registered at the national level? And even at the state, some of them might not even be registered. that at the federal level, you'll be hearing some names of donors working in some states in Nigeria that will be so foreign in the ear that we don't even know about them at the federal level. So some of these things are real, and for us to address it, government needs to sit, put their feet on the ground, because this thing does not happen in some other countries. Before you go in to do anything, the government must know where you are going, and by doing this, we try to map them so that they go to areas where they are most needed. But without this, you find them being clustered in a place when some places are being denied. They won't even have any donor present in some of these places. And aside from coordination and leadership, the structure. From every indication, the political structure of Nigeria is such that the states they can do whatever they want. You don't have any right to say a donor should not come to them, but things should be done properly. And for us, I'm just thinking that if these countries should have a basket fund for nutrition, so that every donor coming in puts the money in that fund, and the government with the donor and donors decide where to send these monies. Secondly, at the donor level, they have their own coordination platform. At that level, they can help the country to ensure that they share or areas of work, the areas they will cover, so that no state, no area is left. But you see donors, they will be in this LGA implementing just in 2 words, run to another way, doing something. But if at the donor level they are working together, they will be able to identify areas where there's need and map themselves and enter and provide the interventions that are needed. So I've said it, the understanding of our political leaders is very important. Do they understand that nutrition is important? It's very important. And like I said, at the national level, at NCN, and at the NCFN level, we've seen that leadership and understanding being played out. And another thing is that for this programmation that is happening, it needs coordination, and coordination requires funding. Without funds, you cannot coordinate. Coordination has activities attached to it. And if you don't have money to implement those activities, you have your meetings, you have your TOR to implement. If you don't have money for coordination activities, there's nothing you can do as far as coordination is concerned. And secondly, MDAs should understand their mandate, so that when a donor comes to you and that activity the donor is bringing is not related to what you are doing, please redirect that NGO, that donor, to the organization where they are best fitted, so that with this we work together to achieve our results. So these are what I can say so far. Thank you.
Thank you very much, ma'am, for that very comprehensive. It's very important for, I'll start from the very last, for MDAs to understand their mandates, because it's in understanding their mandates that they will be able to guide donors or partners in the right direction, based on the local needs and all of that. What I'll be very keen to hear, maybe as we go along, is how whether there are mechanisms in the state level, right, where they prioritize nutrition needs based on, like Nima said, based on evidence and not based on opinion. And and I know that is also circling back to MDAs understanding their role, because essentially it's understanding their roles that will help that. But I would like to hear about that more as we go along. So I'll go over to, as we transition to CSOs and partnerships and all of that. Lillian, CSO play a vital role in fostering partnerships with, I think, over 200 CSOs now, government and other stakeholders. So please, can you share with us, tell us how you ensure coordination or a coordinated and a unified plan of action or line of action towards addressing malnutrition in Nigeria?
Thank you so very much, Uloma, for that question, and CSON is excited to be here. Let me start by saying that CSON, the Civil Society Scaling Up Nutrition in Nigeria, is the Scaling Up Nutrition Civil Society Alliance for Nigeria. And we are an alliance of over 400 civil society organizations, and not 200. 400 civil society organizations, faith-based organizations, community-based organizations spread across the 28 states plus FCT in Nigeria, and also doing some form of work across some African countries like Kenya, working tirelessly in collaboration with state actors, MDAs, development and implementing partners for nutrition in Nigeria to ensure that Nigeria scales up nutrition interventions and thus contributing to the reduction of malnutrition in the country and even beyond. And we are particularly very, very passionate about ensuring that every Nigerian has food and is nutrition secure. Now, CSON fosters these partnerships among civil society organizations, ministries, departments, and agencies, implementing partners and donor agencies like UNICEF, Alive and Thrive, Save the Children, and a host of others through some established strategies and mechanisms, through advocacies, capacity building initiatives. We do this as well through media engagements, and then ensuring that multi-sectorial and multi-stakeholder coordination platforms for nutrition through ensuring that they work. Now, CSON at the national and across her various state charters initiates and leads collaborative advocacy efforts for nutrition in Nigeria. So we do lots of advocacies, and we do not do it alone because we understand that the more the voices, the stronger the impact. So we do collaborative advocacies, collaborating with key nutrition ministries, departments, and agencies, and other implementing partners that are working to ensure that we improve the nutrition outcomes of the country. So we do these collaborative advocacies to key government functionaries, key ministries, and we advocate for issues related to improving the nutrition funding for the country, issues around ensuring that we have policies for nutrition and ensuring that these policies are implemented. Our advocacies, joint collaborative advocacies, are also tilted towards ensuring that we have a favorable space, for nutrition in Nigeria. Talking about maternity protection policies around 6 months paid maternity leave in Nigeria that would ensure that, women are able to breastfeed their children exclusively, to ensure optimal brain development and all of that. And then we also do these advocacies for so many other key issues, that would help us improve nutrition outcomes in Nigeria. Most of the partners seated here, and even our former head of nutrition, at the Ministry of Budget and Economic Planning, would agree with me that these advocacies have yielded positive results for nutrition in Nigeria. We have seen some improvements in the level of nutrition funding, through our budgetary tracking. We do lots of budget tracking, and then at the end, these evidences show that we have made some level of progress with regards to improving nutrition funding. And then we have also seen through these advocacies the approval, the implementation, and the domestication of the National Multisectorial Plan of Action for Food and Nutrition at the state level, particularly in the states where CSON work, and then in other states where we are receiving funding, to implement nutrition interventions. Also in the area of 6 months paid maternity leave, these joint and collaborative advocacies have yielded strong results. Only recently, the Cross River State government has approved 6 months paid maternity leave, for nursing mothers in the states as a result of joint collaborative efforts of CSON with support from the UNICEF project to see that women are able to exclusively breastfeed their babies. And in addition, we are very, very passionate about evidence-based advocacy for nutrition. And in that light, we understand that you cannot do advocacies without data. Under her leadership, CSON was able to work strongly with the Ministry of Economic Planning, the Ministry of Budget and Economic Planning, I beg your pardon, to institutionalize the performance management system for nutrition in that ministry. So that system is a digitalized system that enables key nutrition ministries, departments, and agencies at the national and at the state level to collate data, to impute data, to analyze data, and to, on a quarterly basis, report the performance of nutrition-sensitive and specific interventions across their states. If you go online, you would see some information around the best performing states and all of that. And in addition, we strongly support multi-stakeholder and multi-sectorial coordination platforms for nutrition in Nigeria. So we support the meetings of the National Committees on Food and Nutrition. We supported state governments to domesticate the terms of reference of these national committees at the state level. And CSON supported the establishment of the first ever local government committee on food and nutrition in Orile, I think a local government area in Lagos State. And then as well, the scaling up nutrition coordination meetings that brings together the government, the civil society, the academia, the business network, and the donor networks. We contribute to and support to ensure that all of these platforms are working very effectively towards improved coordination and improved nutrition outcomes for Nigeria. Thank you.
Okay, thank you very much, Linia, for that. I particularly, I was intrigued really by the large span of work that you do, coordinating over 400 CSOs in 28 states and making everything, of course, being evidence-based and all of that. I will come back to you in terms of, to touch on how you balance the diverse needs of, different stakeholders as you coordinate them and scaling up nutrition efforts and all of that. I'll come back to you on that. Okay. So I will head to Aisha. So we're going to now shift focus a little bit to policy engagement and perhaps multi-sectoral coordination and the work that you do in Sahel Consulting. So I do know that Sahel Consulting is involved in policy advisory. Can you perhaps tell us policy advisory as it relates to nutrition specifically at the national level and at the sub-national level? So what barriers, can you tell us what barriers do you face when providing policy counsel to the national or state government, or perhaps in working with all the other organizations as it relates to the nutrition sector? there is a committee right now would help. I believe so. But there maybe now coming from the aspects of now I'm beginning to wonder. I'm just keen to know, how many organizations out there are even operating that are not even aware that they should, register, and that also underscores what Mrs. Shido has said earlier around even MBAs, making sure that before organizations come to work in the States, that they have done their due diligence in registrations before they actually begin work. Because I'm just wondering if Sahel Consulting is finding out during this panel session that there's something like that, then there are a lot. Oh, okay. Oh, other partners. Thank you very much for clarifying. Oh, okay. So I'll come back to Mrs. Chito now on. Can you please tell us in terms of the discussions around the leadership coordination? Yes, you talked about it at the national level, but now at the community level, how can we better involve the community level stakeholders? Maybe let's not go down to community, but let's start even from the LGA to all the other subnational levels. How can we better involve these stakeholders to make nutrition programs more responsive to local needs, making sure that these nutrition priorities in their locality is based on their need and not based on what the partner wants?
Okay, thank you very much. We've said that nutrition is implemented through multi-sectorial efforts, and where the burden lies is within the community. And we have this coordination happening at the federal level, we have at the state level. There's now a push for us to have the local government committees on food and nutrition that will be chaired by the deputy chairman of the local government. And thank God, this autonomy that is being revived for the local government, we believe is going to make, to help us in a lot of things. Because in those days that we have the local government system working, we know that the primary healthcare system was better off. But when the issue of autonomy came and the local governments became so voiceless and weak, we know that a lot started happening in primary healthcare. In this vein, with the coming back to the local government system, I believe that the local government committee on food and nutrition should be up and running and support whatever programs, nutrition programs that will be taken down to the community level. Aside from the local government committee of food and nutrition, the policy designed that we should have a world committee. At the world level, we have the food and nutrition committee at the world level. These are all avenues by which the stakeholders at the grassroots should be better able to understand the nutrition situations in their communities. And like we have at the national level, we have leadership training. At that level, community stakeholders should be trained. They should have leadership training so that they know in how to be involved, how to understand, this concept of nutrition. They need to understand it, and being closer to the people, they will know those that are affected, how they will solve the problem, available resources within their communities. Don't plan anything from outside and throw it down on the community. We've seen that the problem we have in this community, something else, not getting vitamin A. How do we ensure that the health facility we have around gives our children vitamin A supplements? So they need to have that understanding to know what actually the nutrition challenges of their people. And being there with their people, they should be part of the plan. They will be able to assess, if you do this, this one is lacking, we are not going. They know amongst them who can support them, among their children, who is wealthy enough to undertake a project, and with that, we should be able to have good nutrition outcome, and because they are there, they should be able to monitor. Accountability is very key. We have incidents of these days when you said you send ready-to-use therapeutic feeds to states, you find them in marketplaces. A case was discussed during the last NEC of commodities sent to states being found in the market. These are all challenges that if communities are aware, you're a health worker, you are going to local government to bring 2 cartons of ready-to-use therapeutic feeds. When you come back, the community leadership, through their World Committee on Food and Nutrition, we go there and check. You say you are going, have you brought it? So their involvement is very important, but if they are not aware, if they are not aware of their roles and responsibilities, they should not be able to do this. So we need to build their capacity to know their roles and responsibility, and we know that nutrition education at that level is also very important. Community stakeholders should be aware of the situations and should be able to create awareness on how to address such problems. Thank you.
The community level, at the local government level, and all of that, but actually most important, the building their capacity, because how would they be able to make decisions for local needs, union-based decision making, which we are trying to avoid. Yeah. Thank you very much for their objectives that they want to achieve.
So basically for us at CSON, our mandate is to ensure that every Nigerian has food and is nutrition secure. And as it stands, these discussions here today is looking at multi-sectorial collaboration and coordination for nutrition. So for us as an alliance, any civil society organization, faith-based organization, community-based organization that is working in the nutrition and food sector, our doors are open and they are always welcome, to join hands with us, to come up with stronger voices and stronger advocacies, towards ensuring that we improve Nigeria's nutrition outcomes. Balancing the various needs of these civil society organizations is an enormous and a huge task. So we have various platforms where we engage with our civil society organizations and networks. Of course, we have statutory meetings like our annual general meetings where we convene, converge, discuss, rub minds, sort out the challenges of the civil society organizations, So all of those statutory meetings afford us the opportunity, to reinforce as Nigeria's civil society alliance, that is aligned to the Scaling Up Nutrition Network to ensure that we are moving along the path of contributing to eradicating malnutrition in Nigeria. We also do lots of capacity building initiatives. There are lots of activities, that we run to empower our civil society organizations. So no civil society organization that is working in the nutrition of food sector space, is left out. We want to encourage and say that they are all welcome to be part of CSON. That is on the one hand. Then in terms of balancing the needs of government and other key stakeholders, of course, we do not see ourselves as adversaries to the government. CSON has moved away. There is this mindset that civil society organizations will have to carry placards, protest. No. We don't do that in CSON. We don't position ourselves as adversaries to government. Rather, we see ourselves as partners working to support government in a shared vision, because we are looking at multi-sectorial collaboration and coordination. So we see ourselves as partners with government in a shared vision, working towards eradicating malnutrition in Nigeria. So when we see gaps, when we see the bottlenecks, when policies are not implemented, when there is no funding for nutrition, we don't go carrying placards. We don't criticize. We do evidence-based advocacy. We speak up through advocacy. We push out our calls to action. We are also very, very supportive of, initiatives of government. We provide our technical support We give them evidence-based data that will contribute to informed decisions around improving nutrition outcomes. And then for our other stakeholders, for our implementing partners, our donors and all of that, we enjoy celebrating joint successes because we believe that only CSON, or we believe that only one organization, only one MDA it takes, to change the narrative. Whatever we do in CSON, we do collaboratively and jointly. So when that success around improved funding for nutrition, in Nigeria comes on our website, on our social media pages, we acknowledge those collaborative efforts and successes that are tilted towards improving nutrition in Nigeria. And speaking about supporting government, that does not negate our responsibility of our account in terms of policy implementation, in terms of funding and all of that. And we have been doing that in CSON. But we do it constructively, we do it collaboratively and in a supportive manner. So for instance, in the last few years, CSON has always been in the forefront of holding government to account on the Nutrition for Growth commitments made for Nigeria. So we host lots of collaborative media roundtables, we host lots of social media campaigns, holding government to account on the commitments they have made has at the end of the day, yielded some positive results in terms of fulfilling those commitments. Thank you.
Okay, thank you very much, Lydia. Hope we do is that, like CSON, everybody should work with the government as a shared vision. So we need to align our vision with what the priorities are, which of course have been informed by evidence. So I hope that we all took that note, not to reiterate. All right, so I would move on to Aisha. You had mentioned some of the barriers that Sahel Consulting face in terms of in the work that you do as it relates to nutrition. Can you throw more light on how Sahel Consulting actually contributes towards improving multi-sectoral coordination, especially between the private and public partnerships?
Yep. So we are very much in the business of advising the government, advising donor partners, and advising private sector organizations. A few years ago, 2 years ago, we did a policy gap analysis in the rice sector for the whole of the ECOWAS region. And we chose rice because that is something we Africans, West Africans, have in common. And if you want to target nutrition, start with rice. So we went through all the policies to look at where are the leverage points that we can actually improve nutrition through rice. And one of the things that came out, and this was in collaboration with the ECOWAS Commission and GIZ, one of the things that came out is fortify rice. So once we have a fortified rice variety in the market, then it means everybody can be able to get that into the market, and off we go into our nutrition indicators. So that's one. Two, this example is very close to my heart. Where should they direct their investment so that they can make nutritional impact, they can make impact in women's economic empowerment, and then farmer livelihoods and income? We profiled about 12 different value chains, and dairy came up on top, milk and milk products. So if done correctly and leveraged locally, Nigeria has, I think, the third largest cattle herd on the continent. So if done locally, we are going to have very affordable and accessible, energy-dense, high-quality protein source, which is our milk, our cheese, and our butter. So this actually spun off an almost a decade-long intervention in the dairy value chain for a program that we call Advancing Local Dairy Development Program in Nigeria. So that has not only the nutritional impact, the livelihood, also own the cow alongside the milk. So beyond that, there is also the security. So this lot of consultative forums and groups going on nutrition. So we need to galvanize. So it shouldn't just be nutrition, health, and agriculture in the room. nutrition, health, environment, water resources, women affairs, everybody. We need to be speaking with one voice. And another thing that we're doing in targeting this is changing narratives. We have a sister company called African Food Change Makers. And this is a platform for young entrepreneurs that are working in the food and nutrition sector. If you are in production and processing of nutritious foods, the narrative is that Africa is poor, we need aid, and our food is not nutritious. That is not true. Our moringa, our zobo, our acha, our ukwa, very nutritious. So these young people are packaging this in a very, very safe and nutritious way, an appealing way. So the world deserves to taste what we have in Nigeria, and that is what these young people are doing. Thank you.
Thank you very much for that. It's actually very, very, very key that all the different sectors are involved in these kinds of discussions, and it's actually it's encouraging the work that you do in Sahel Consulting, particularly for the complementary policy that has gone out. So now that we have heard from our panelists very insightful conversations and discourse that we've had, I'll open the floor now to the audience. Let me quickly confirm that Dr. Osita is there before I move to the audience. Any signal? Okay, so they will let us know when he's back online before we continue. But then in the meantime, we'll continue. So we'll open the floor to the audience for questions. Please raise your hand and I will call on you for, I was going to start with two hands, but I've seen double, which is fine. So we'll start right there. 1, 2, 3, 4. Right.
Okay, thank you very much to all the speakers for sharing very deep and rich insights. My question goes to Madam Chito Nelson, especially because you headed nutrition, at the Ministry of Budget and National Planning, and we're here talking about coordination bottlenecks and how to integrate different parties together to work towards a shared goal. So I would just like to find out to what extent the ministry worked with CHIPS agents. CHIPS agents are community health influencers, promoters, and services. And they're a community mobilization group under the National Primary Healthcare Development Agency who work at community level for sensitization and community awareness. So just to find out how your unit was able to work with that group and whether you were able to integrate nutrition information into the current curriculum and also have that as part of the services that they render at community level. Thank you.
Okay, thank you, everyone. Thank you to the panelists. So my question is to Madam Chito. As someone that has been in the Ministry of Budgets and Economic Planning, and from the discussion here, the coordination is actually at that on your table. What will you say is the bottleneck, considering the fact that probably permanent secretaries and ministries and permanent secretaries are civil servants? Are there structural issues that is not making them be at the forefront of proper coordination? Another thing, I think you mentioned the fact that there was a performance management system where you link from the federal to the states and also to the local governments. Can that also be maximized for coordination in terms of ensuring donors are registered both at the federal ministry and at the local governments, so that real time you see who is working where, and that could be a dashboard where you can have all partners in different local governments and in states. Thank you.
All right, so I'm building on what Shiv said. It's also about coordination. So Mrs. Nelson, my question goes to you as well. Just trying to pick your brain power and experience over time around nutrition sector in Nigeria. what could be done to address the pain points highlighted by Aisha, moving from one to another and knocking because you have a project that cut across different entities and ministries and agencies? What can be done to address that kind of issues? Thank you.
All right, thank you very much. Good afternoon, everyone. My name is Kimberly. I work with Health Strategy and Delivery Foundation. We're very similar to Sahel Consulting. We do the same thing, using evidence for policy advisory. So I think my question is for Madam Lillian, and it's also kind of buttressing a little on what Aisha mentioned. So recently we launched, I think Mrs. Chito Nelson is aware, we launched the National State of Nutrition Report, which HSDF supported the development in collaboration with the World Bank. And there is also a nutrition dashboard in the works, right? And I will agree with you that climate change, so for this report, our focus was food insecurity. We didn't find data on climate change, just like you mentioned, but I wouldn't say it was their fault. They had data, but they've never been involved in nutrition discussions. They don't know what kind of indicators we're looking for. So to just not agree with you completely, there is data, right? But they're not just in a place. You have to walk the block to get the data. So my question is to Madam Lillian, I know CSON is doing a lot with advocacy and things like that, but what about this information on the structures that exist for coordination? If there is that information out there, it's easy for organizations to come, find out, because I think we struggled earlier, but because we were now integrated, we knew the coordination bodies, we were involved in those meetings, it was easier to find what we wanted. So I won't say we are there yet, but on a positive note, we're better than where we started as a country, coordination-wise. The TWGs, the SCFNs, the NGF, everything. Right. I feel they're good bodies that are already, gearing us towards coordination. So my question is, what is CSON going to do to put that information out there so everybody can easily know where to go?
Okay, thank you very much for those questions. Hold on. So this is the last person. We had a little bit of ojoro in this, but it's fine. Please, can you give the last person the microphone? Please, short and simple, nail on the head, so that right now we have Dr. Osita on the call, okay, so that when we are done with the questions, we go right to him before we answer.
Right. Okay, straight to the point. Aisha, you have listed that there is no guideline for the do's and don'ts for partners to even know if they're permitted to intervene in, how to go about it. And we have established that there's no lack of policies, frameworks, and you're supporting in a policy capacity, advisory, especially at the NCN. So are we looking at including this in the multisectoral plan of action, say, after this 2025 elapses? Or what is the best way to actually guide partners and ensure that partner mapping happens? Because earlier on, Mrs. Ladidi mentioned that they do partner mapping. So is it just the health sector that does the partner mapping? Is it the Federal Ministry of Budget and National Planning that is doing this? We need that clarity. Is it going to be included in the multisectoral plan of action, or how do we tidy up this bit? Thank you.
Thank you very much, Safia. Before we go on to our distinguished panelists to answer, we have the Dr. Osita on the call. So let's quickly take up his parts before we go on to the answers. I'm trying to look at the screen to see if Dr. Osita has been
recording
connected.
Stopped.
Yeah, I can hear you.
Okay. Hello, Dr. Osita. It's good to have you on this panel. I would reintroduce him. Dr. Sito Okonkwo is the Country Director of Nutrition International.
Recording in progress.
Nigeria. Dr. Sida, thank you very much for being here once again, for making our time. Could you please share with us from the work that you do in Nutrition International, and I believe one of your roles or one of the work that you do is technical support to the government on nutrition matters. Could you please share some of the challenges you've encountered in ensuring that nutrition is adequately prioritized and resourced at both the national level and the subnational level, because I understand you work at both levels?
Yeah, thank you. If you can hear me?
Yes, we can. Please go on.
Oh, great. Oh, sorry, I had multiple meetings, and one of those were the global meeting that I needed to join, and the time were conflicting. So I had joined the earlier section. I had also assumed that based on the timeline, we had started by 12. So when this meeting didn't start, and mine was starting at 1 o'clock, I had to join my official meeting, but I'm fine. Sorry about the delays. I don't know what my other panelists have discussed or have said, so I wouldn't be repeating what people have said. But coming to what we have experienced as challenge in working within the system, one of those, of course, I'm sure everyone knows, is the areas around coordination for nutrition in Nigeria, which was weak. And for that reason, Nutrition International in 2021 commissioned a study to identify the bottlenecks to coordination for nutrition in Nigeria, and then came out with far-reaching recommendations. And one of those recommendations were oftentimes, were presented to the National Council on Nutrition, chaired by the former vice president, and was adopted. And what was in there was that the MDAs that are also linked to nutrition across the country seem not to have identified nutrition as a key component of intervention in the country. And for that reason, they have not prioritized nutrition in their directorates. So one of the recommendations was that government should, as a matter of urgency, identify nutrition in every of the MDAs, and then create the directorate and budget lines for them. Because budget line issues was a major issue for nutrition implementation in the country. Now, you and I know that we had a multi-sectoral nutrition action plan that was developed, but it had never been reviewed, never monitored, and never tracked. So we also feel that if that document was actually implemented appropriately as expected, it could give government of Nigeria a snapshot, view of where the government is on issues around nutrition in the country. That's on one side. Again, you also may be aware that one of our key interventions in Nigeria is vitamin A supplementation, which we provide through our partnership with UNICEF and distribute across the country to be distributed during the Maternal and Child Health Week in the country. Now, most of the states are not implementing MSH Week as at when required and when due. There is a requirement for it to be done twice in a year, 6 months apart, and then between May and June, and then also between November and December. But I can tell you that beyond the support provided by partners like UNICEF, NI, and others to states to enable them to implement these activities, those states that are not receiving this support are eventually not implementing this activity that is very vital for administering vitamin A for children on time. So in the last round of vitamin A supplementation we did through the Maternal and Child Health Week in Nigeria, out of the 7 states that are not currently being supported by partners, only 1 state was able to implement it as at when due. The rest were implemented off time, which of course were sometime in July, somewhere in August. So we feel that there is need for NPHTDA, which is a driver for the Maternal and Child Health Week implementation in Nigeria, to come out strong and ensure that there is a definite identification of timeline and dates for this activity to be done. Am I still being heard?
Yes, please.
Hello?
I can hear you.
Because my video is frozen. Okay, sorry. All
Yes,
right.
please,
So
can
we
hear
feel
you.
that there is need for the primary care agency. I'm surprised they are not in this meeting today, or rather than this panel, to also identify their role to ensure that they were able to map out a particular period in the year, just like we have the Nutrition Week, which is usually happening the first week of November every year, and we have the Breastfeeding Week, which happens the first week of August every year. We need the government to also identify a period within this timeline that could enable states to prioritize maternal and child health week as a driver for administering vitamin A for children in Nigeria. That is very important. We had made some advocacy across the country to talk to leadership in states, and they have also seen that the need for them to prioritize this very, very important intervention, which delivers vitamin A and other vital nutrition interventions to children and pregnant women. That's also very important. Now, let's come down to other drivers that will help government to ensure that we are addressing nutrition as required. Currently, we are working with the government of Nigeria through the National Assembly and then, of course, the state assemblies to see how we would begin to look at appropriate oversight and support to policy and legislation for nutrition. And with the onboarding of the National Assembly's Committee on Nutrition and Food Security, which we are also supporting through our technical assistance to the National Legislative Network, which is an offshoot of that committee, we are seeing a new dimension in how government is able to begin now to address issues of nutrition at the level of budgeting, because a lot of times not appropriate budgetary provisions are made for nutrition in states. And again, during our interventions with some of these state level legislators, we did observe that most of them are not even aware of what nutrition means and how nutrition programs are implemented. And it is becoming very important that now that the government is looking at that direction with the support of partners, this is a very important aspect of what we feel that the government should also focus on, how to build their capacity, to be able to know what needs to be done to ensure that states are able to, in their own level, provide adequate budgetary provisions for nutrition in their budget, and more importantly, creating adequate environment for nutrition to be seen as a deliberate effort for each MDA, which in this instance means that the government should create departments for nutrition in all the vital NDAs and appropriately resource them and provide the resources required for them to implement. And I can assure you that partners are available to support them to build their capacity, and also see that when these units are created, or do I say departments are created and appropriately resourced and financed, then we could know that the government is serious about taking nutrition to the next level, and then we could also be able to help them to build their capacity and monitor and provide monitoring platform for accountability in the systems. Let me stop for now and take your questions. Thank you.
Thank you very much. Thank you very much for that. One of the things that we have discussed and have been emphasized already also came up again, and that's the need for the nutrition stakeholders to actually understand the importance of nutrition and then prioritizing their capacity building. But that's one of all the things that you have discussed in terms of how you collaborate with both the government and the partners to make sure that nutrition delivery is done in a harmonized manner for maximum impact. You actually did answer my second question, and thank you very much for that. I will actually open the floor one more time for any questions. Just one more question. If there's one question for Dr. Osita, Okay, just one more question. One, because of time. One. Okay, is that for Dr. Osita? Okay, please go on.
Okay, good afternoon. So it's been an amazing session. I'll just go straight to my question. Funny enough, I was listening to Aisha speak, and the question isn't directed to her. I'm just trying to do a linkage. So I was part of the delegation that had this Aero Assembly with ECOWAS, I think about 2-3 months ago, on the first ECOWAS Rice Observatory Assembly. And I'm curious as to how Nutrition International is able to leverage rural communities, because before we begin to talk about the quantity of this foodstuff, so I mean, nutrition supplements we're talking about, what is the quality that we already have on ground? I don't know what systems are in place and how Nutrition International is able to leverage their networks to have rural communities build up on quality, and then before they begin to talk about quantity. That's it.
Okay, thank you very much. Because we would prioritize Dr. Osita because he's a virtual speaker. Can we have Dr. Osita perhaps respond to the question on how a bit of a background, a lot of the things that Aisha has spoken about before he joined is on the work that they've done in more like highlighting or putting in the front radar local commodities, right? And then, you know, how that can now be more promoted. And he's asking how we can leverage these rural communities in relation to this.
Okay, yes. Basically, issues around nutrition is multidimensional, like you know, and then we also encourage the use of local resources we are available that have appropriate nutritious contents. And we are working with the government at the state level and also at local level through our partners to see that nutrition education is appropriately provided to pregnant women at national and other care centers across the country, and in some locations, in some states where we work directly. And what that means is that we use local resources for solving local problems. So in those instances where there are appropriate local dietary diversity that can be identified, those are emphasized in those contacts with pregnant women at the ANCs, and then be demonstrated to them. So there are level of food demonstration that are happening during those contact times with ANC, at ANC with the pregnant women, whereby these very unique condiments, or do I say available food resources are also provided to them, and then they are also guided on how to use them. We don't do food security directly, or rather food system directly, but because of the fact that we work on micronutrients, we identify micronutrient-rich, food that pregnant women could actually be used, and also what they could give to their children to be able to prevent issues around onset of malnutrition on both sides. So, answering your questions, yes, we work with government, work with the communities, and also we have people that were trained to work within the communities to conduct some behavioral change interventions, which also addresses some of these needs within the communities using local resources that are available to them.
Thank you very much, Dr. Osita, for providing clarity to that question. So we'll go to the rest of the questions. We have a couple of questions, about 3, for Mrs. Chito. So I'll let her have the mic now. The one about to what extent the ministry has worked with chiefs agents, how nutrition information is being integrated into their work and all of that, and also highlighting bottlenecks for proper coordination. Someone at the back had asked, and also I think that's about the 2 of them, please.
Okay. Yeah, thank you very much. On working with the chiefs, the Ministry of Budget and Economic Planning, we do not, I'll keep on saying we, do not implement activities, but we coordinate. It's coordination and setting up of governance. So the chiefs agents, they work at the community level and they work closely with the National Primary Healthcare. Development Agency, and the relationship, as far as we are concerned, is that the National Primary Healthcare Development Agency is a member of the National Committee on Food and Nutrition, so that every information, whatever is in the policy, whatever is in the plan, they will try to pass it on to the chief's agents. The ministry does not work directly with the chief's agents. It's not an implementing entity. The ministry is not an implementing entity. On the bottlenecks, I've said it when I was talking before, there are structural issues. At the macro level, we need to have, the way when AIDS came, the way we had a body that tackles the challenges of AIDS. That's what we need to address the nutrition situation in the country. And when you go to NACA, you see an organization working to end something, and they really achieved. That is what we need for nutrition. We've asked that an agency be created, but the fact that there are a lot of ministries, that government is spending a lot on personnel, but it's very key. If we should have an agency to address nutrition issues, I think we'll be better off. Because in that agency, you have full-fledged of staff that will run with every aspect. If you are talking about coordination, partner mapping, that's a department. If you are talking of MIE, that's a department. I think that is the way to go. But we are still just treating this the way we are treating it. Secondly, at the macro level, we need structures. Like when Dr. Oster spoke, a recommendation was made after an assessment that we need nutrition departments in all MDAs and in line ministry. Going on with that, the vice chairman, Professor Shibanjo, when he was the chair of NCN, pushed, and we had, through the president, and we have a budget line for nutrition, and we have a presidential directive for the creation of nutrition departments. So far, only very few, only two MDAs at the national level has set up the nutrition department, and at the state level, the states are even doing better. Some states are doing better because they've established, nutrition departments and budget lines for nutrition. So that is what I can say about it, because if you have a department for nutrition, you have your budget line. This is a time when budget is being prepared. You wouldn't need to lump the budget for nutrition under another department. And when they get there, you tell them to start splitting. Like what is happening in the Ministry of Budget and Economic Planning, there are 3 divisions in social development, nutrition, food and nutrition being part of it. When money comes for the department, they start splitting it. You get 30%, you get this percent, you get this percent. That is not what the presidential directive says. You should have a budget line for nutrition, but effort is ongoing to ensure that that is done. And setting up of nutrition departments in the ministry is something everyone should push, so that the ministry, you had this directive from the president, you wrote to states, the states are complying, but you that sent out the letter, the Federal Ministry of Budget and Economic Planning, they've not done that. These are part of the questions the peers should have been asked. And any other time you have the opportunity of meeting with him, ask him what is the situation as far as this is concerned in the ministry. On what Aisha said about, some organization will be implementing and later something will happen, I believe it's about harmonizing our plan in whatever area. If you're in water, those in water, let them harmonize, have a joint work plan, and know how to time it and know how to proceed. Harmonization, working together, cooperating is the way to go. Thank you.
Thank you very much, ma'am, for that. Harmonizing is the way to go, and that's the whole essence of this discourse today. Collaborating, coordinating efforts so that we are working towards one harmonized goal. So I'll move on to Aisha. You have a question on how you're looking to more like clarity on how the guide for partners in the multi-sectoral plan would be.
So, as we have heard today, the nutrition sector has one of the best coordinating mechanisms in place already. So the issue is, we've seen it in Adanna's presentation, so it's clear who is doing what at that level and how it cascades down. The issue is that negative feedback loop. Who is transmitting that information out to the partners? Who is in charge of that? We don't know. So if we can strengthen that, that's one arm of it. The second arm is around partner mapping. Yes, Mrs. Ladi did mention that there's a partner mapping that is going on or should be going on, but that would be done from the perspective of health and nutrition. As we speak now, Ministry of Agriculture, Mr. Kilishi is not here, they are also doing a stakeholder mapping, and that will be done around the domains that is prioritized by that ministry. And that is how we will continue to do different stakeholder maps. Some stakeholders would overlap, some will not. So what we need to do, and I agree with you, Safia, this needs to be on the agenda for the next meeting, that there needs to be one food and nutrition security mapping, comprehensive, everybody that is concerned involved. I agree, should be on the agenda. Yes.
Yes, I was actually going to say the same thing, that it's very important. That's the fragmentation that we are talking about, and these conversations are what will help to harmonize efforts. So one key takeaway from this conversation is a holistic, harmonized map for partners that work in nutrition programs. So Lillian, over to you. I think you have one question that was actually thrown to Mrs. Chito, but I think it was for you. Management, performance management
system.
Yes, because you were the one that spoke about performance management and how that system can be used for coordination. And then the second question is around nutrition advocacy.
Okay, thank you so very much. So I think the first question, was around how we can maximize the PMS for donor coordination. So recall CSON's role is to hold government accountable and to appraise government. And that was what informed the development and the digitization of the performance management system. So it's actually an appraisal tool for ministries, departments, and agencies. In terms of nutrition funding allocations, how well they have performed. In terms of implementation of policies, for instance, the National Multi-Sectoral Plan of Action for Food and Nutrition, the level of implementation is also actually about the effectiveness of the state committees on food and nutrition and all that. So, but then we can look inwards and see how we look at, in terms of funding, from donors. We can look inwards to see how we integrate funding from donors for nutrition into the PMS. But we cannot use the PMS for donor mapping. But we can make this recommendation to the donor network of the SON network in Nigeria to see how we all collaborate, to come up with a donor mapping. And we might take it further because we are looking at a coordinated system across board, be it donors, be it civil societies, be it MDAs, and I think those are part of the key takeaways that we're getting from this meeting. And then someone asked, the second question was around, what CSON will do to put the nutrition coordination structures in Nigeria out there. So CSON has been doing a lot with these nutrition coordination structures. We are members of the NCN. We support the national committees on food and nutrition, the state committees on food and nutrition, and the likes. So we've been doing a lot to put out information, around their effectiveness, around their initiatives, across most of our communication channels. But we believe that it is the mandate of one key nutrition ministry, which is the Ministry of Information and Culture, or Ministry of Information and National Orientation, to really take on the responsibility of information sharing, around these structures. So, but on our part as CSON, we will continue to do the much that we can, and we continue to support this key government agency, that is saddled with the responsibility of pushing out information, to push out information from our blogs, on our websites, on our communication channels, around how effective these structures have been. And we're hopeful that with those communication efforts and all that, would create the ample visibility, that is required to let key stakeholders or the general populace know about the existence of these structures. Thank you.
Thank you very much. Advocacy, like me particularly, and for most of us in this room, we know the power in advocacy, in pushing these kinds of conversation upwards. Thank you very much. Thank you to my distinguished panelists for bringing in valuable insights for how we can coordinate efforts in the nutrition sector, and of course to the audience for participating. I could tell from the questions and all the hands that were up, even those that we could not take, that you were very interested in this conversation and you deeply participated. I will just highlight some of the takeaways from this discussion right from the beginning. And one of the things that came up from this discussion is the need for a basket fund for nutrition, and that would help in coordination and also addressing the gap when it comes to limited resources because of fragmentation. We also have the subnational coordination platform that is also in the works, and then a guide which we've already talked about, the next step now for Aisha, to push the need for the harmonized map for stakeholders that would address the guide for stakeholders working in nutrition, and then of course the drive for the local government committee on food and nutrition, and again something that kept on coming up again and again, the need for capacity building for those working in these spaces, because there's no way that nutrition would be prioritized if the people in question do not understand that it's important or do not see nutrition as an issue of importance. And that's one thing actually that should be on the top of our list, that we should be moving, that we should be pushing, and of course the need for accountability. And as we are working as partners and as government, we need to work with one shared vision, not, okay, this is my own priority, I work alone, and all of that. So essentially, and of course, also driving the development or the units or departments now on nutrition, because that is the way that we can have a budget line for nutrition, and of course we cannot achieve a lot without money. Thank you very much. I do appreciate your time. So thank you very much. A round of applause. Okay, thank you very much. I think the panelists now will take a picture, and then I'll hand over to the MC.
Please a round of applause again for that amazing discussion. These are the real Wonder Women, because this panel was just, very on point. So at this particular point, we're wrapping up now. Lunch will be served shortly. I'm going to call on Zubaida Baba Ibrahim, who is a sub-editor at Nigeria Health Watch, to essentially walk us through salient points that have been captured today in the event's communique. Zubaida, please. Round of applause for her as she comes to the stage. Thank you.
Thank you. Thank you so much, Chris. Good afternoon, everyone. Thank you for your attention so far during the whole event. So today we've talked a lot, we've said a lot, and we've had meaningful discussions, and we have highlighted the challenges to improve nutrition outcomes in our country. We have also preferred recommendations and commitments geared towards addressing coordination gaps and bottlenecks. We have also established that the nutrition landscape is multisectoral, that encompasses agriculture, health, wash, and environment sectors. So some of the challenges the panelists have spoke of and our guests have talked about are the lack of there are enough policies but not enough implementation and coordination and monitoring. We have weak monitoring and evaluation and data systems, absence of budget funds for nutrition in certain MDAs. Donor mapping is also problematic due to lack of documentation from donor agencies and inadequate policy and strategy implementation. We also spoke about insufficient funding and resource allocation. And we also discussed some organizations or MDAs not factoring climate change as an issue in nutrition gaps. So some of the recommendations that were made were the need for nutrition stakeholders to understand the importance of nutrition and nutrition programming. There's also need for nutrition departments in all ministries, departments, and agencies. We also spoke about the need for comprehensive long-term investments and focus on maternal and child health. We also talk about the need for regulatory frameworks, and we spoke about laws for food and nutrition in Nigeria so that partners can invest to achieve national targets. We spoke about the need for better communication between the media, CSOs, and advocacy groups for better dissemination of information. We also spoke about having data-informed policies and not opinion-based policies to strengthen data. We also spoke about the PIECE, which is prevention, integration, and scaling up, utilizing of the 10-point agenda for nutrition to drive scaling, basket donor funding for nutrition, and engaging community members for design and implementation so that they can drive accountability. So some of the commitments we all made today is to strengthen the M&E framework, to strengthen communication between all stakeholders, to prioritize sharing of best practices so that others can learn, to establish community nutrition centers through the N774 initiatives. We also said that we will push for a harmonized map for stakeholders in nutrition. So to conclude, I'll just reiterate the mantra we learned today, the 3 mantras. So that is, do you want to go? I heard someone said, yeah, like, so we said the first mantra would be prevention first, and when prevention fails, treatment is a must. The second one was prevention, integration, and skill that's the PIECE. And then more money for nutrition and more nutrition for money. Thank you very much.
Round of applause again for her, please. Thank you. And to conclude this event, I'm sure, again, we really want to say thank you for your time. Physical participants, our virtual participants also. To wrap us up, I'm going to invite Dr. Adachi Eke, who is the Senior Strategy and New Business Manager at Nigeria Health Watch. Thank you very much. Round of applause for her, please.
Thank you very much, everyone. Good afternoon. Distinguished guests, partners, and colleagues, as we draw the significant dialogue and forum to a close, I am filled with a sense of hope and responsibility. Today's conversations have reaffirmed our collective commitment to addressing one of the most pressing issues of our time, ensuring better nutrition for all Nigerians. So the bottlenecks,
it's 3 o'clock.
The bottlenecks we discussed are real, but not insurmountable. We have highlighted gaps in coordination, but most importantly, also shed light on pathways to overcoming them. We must remember that behind the statistics and policies are millions of children, mothers, and families whose lives are directly affected by our decisions and our actions. The real task begins now. As we translate today's discussions into actions, strengthening partnerships, improving coordination, and ensuring that every intervention, no matter how small, brings us closer to a Nigeria where no one goes to bed hungry. Thank you for all your dedication, your insights, unwavering commitment, and I look forward to the positive change that we can all create together. Thank you and have a wonderful day. Please also remember that lunch has been served. Thank you.
Thank you all. Thank you all again. On behalf of Nigeria Health Watch, we want to say thank you to our participants here within the room and those online. Your contributions to these discussions have been quite invaluable, and we look forward to not just talking, but as our WHO country rep has been noted to say, walking the talk. So a lot has been discussed from the keynote addresses to the opening remarks and guest remarks to the insightful panel discussions that have also transpired here today. We look forward to, having all of these translated into, having all these discussions translated into actions. At this point, we'd like to take a large group photograph, and as my as Adachi had mentioned, lunch is served. So thank you again. And all right. Yes. To wrap this up, we'll also be taking a survey. I'm sure the QR code for that will be displayed any minute. Yes. So yes, we understand that Nigeria Health Watch, we are fond of hosting this sort of events, and our objective is to ensure that with each event we're bringing, we're performing better and better than the previous ones. And to help us achieve this, your feedback would be quite crucial. So if you could kindly scan the code on the screen right now, we would appreciate your feedback to incorporate into all our future events. So at this point, we'd like to have a group photograph, I think just by the podium. So feel free to join me. Sorry, can we have someone move this? All right, please come forward now. Group photograph, please. Can we all come forward and wrap this up, and then we go have lunch? Thank you. stand? Some will stand. So can we have the panelists and speakers front, yes, front and center, and then we have others flanking. Yes. Yes. Some can stand at the back. Right. So Sam, could you arrange us? So, okay. All right. So, on the count of three, I'm going to have us call out one of our mantras we heard today. So, on the count of three, we all say peace. Right? On the count of three, we all say peace. 1. Okay, no, yet. All right. So, 1, 2, 3. Peace. 1, 2, 3. Peace. Thank you all. Lunch is served, please. Thank you very, very much. It's been great having you all.